Dawson.
Good morning, my lady. The first witness this morning is Professor Mark Woolhouse, OBE.
We meet again.
If you'd like to stand, please, and repeat after me. I do solemnly, sincerely and truly
I do solemnly, sincerely and truly
declare and affirm that the evidence I shall give
shall be the truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
You are Professor Mark Woolhouse.
I am.
You have helpfully provided a statement to this module of the inquiry along with other statements provided to previous modules. Your modular statement for this inquiry is dated the 14th of December 2023 and has the reference INQ 000369765. Is that your statement?
It is.
Do the contents of this statement remain true and accurate as of today's date?
They do, though we have sent a handful of further exhibits to the inquiry, but I don't think they materially affect this statement.
Thank you very much indeed. You're a Professor of Infectious Disease Epidemiology at the University of Edinburgh.
I am.
You sat during the course of the pandemic on the body called SPIMO between January 2020 and early 2022.
That's correct.
You're also a member of a group about whom we have heard evidence, the Scottish COVID Advisory Group from March 2020. You attended that group regularly, apart from a 2-month absence from meetings in February and March 2021.
That's correct.
You did not attend the SAGE meetings that we've heard about.
I did not.
Thank you. You were awarded an OBE in 2002 for service to the control of infectious diseases.
I was.
You're a Fellow of the Royal Society of Edinburgh,
I am.
of the Academy of Medical Sciences and the African Academy of Sciences.
I am.
We've heard some evidence about your role in providing early information and advice to the Scottish Government, in particular through Dr. Catherine Calderwood, the then Chief Medical Officer. You've given some evidence about that to the inquiry already, but I'd like to ask you some more questions in the particularly Scottish context of this module. Could we have, please, up on screen INQ 000352450? If we could go to, yes, that's the right one. This is a chain of emails which you have helpfully produced to the inquiry between yourself and Catherine Calderwood, is that correct?
It is.
And I understand that you first contacted Dr. Calderwood in connection with your concerns about the emergence of a new virus on the 21st of January 2020, is that right?
It is.
What prompted you to contact Dr. Calderwood specifically at that time?
This seemed to be a matter that very quickly would require the Scottish Government to engage with. And since I wasn't at the time part of any formal advisory system, it seemed to me the logical route to channeling my concerns to the government was through the Chief Medical Officer for Scotland.
And presumably, given the fact that you, as well as having contact with people at a UK level, contacted the Chief Medical Officer for Scotland, you were under the impression that the Scottish Government had the ability to do something about this?
Yes.
Health and indeed public health are matters devolved to the competence of the Scottish Parliament and hence the Scottish Government.
Indeed.
We've looked at some of the text of these emails before. I think the context, please correct me if I'm wrong, of this email is that it follows on from an announcement of recognised human-to-human transmission of the virus the previous day. Is that right?
That's right.
What was the significance of the emergence of that piece of information about the virus?
We already knew about cases of what was then actually called Wuhan pneumonia in those very early stages. And there was the possibility that these had been acquired from an animal source, a non-human source. And it is possible, there are many diseases like this, that the infection would spread from the animal, but could not then spread from person to person. So a human is a dead end from the virus's point of view. Now, that doesn't mean it's not serious. Some of these sorts of infections, like rabies, for example, around the world are very serious. But nonetheless, that kind of infection would not cause a pandemic.
So the evidence which had emerged the day before about human-to-human transmission was a significant piece of information which would affect your assessment of the likelihood of the virus transmitting and potentially reaching epidemic or pandemic proportions.
Well, yes, but it confirmed my fears. I had already received, I think on January the 9th or 10th, a report from, was sent to me unexpectedly, of the Wuhan Municipal Health Authority that already was describing that this was quite a sizable outbreak and had been persisting for some weeks. So I was already thinking this is unlikely to be just an animal origin epidemic, as in the only cause of human infections is from animal sources. It was already, so I was expecting this news that it was human transmissible. I'd feared that for over a week, 10 days.
I see. So this very recent piece of evidence about human-to-human transmission had added to and confirmed your fears about previous information which had been made available to you earlier in that month.
Correct. I thought we were going to have a pandemic, or it was very likely that we would have a pandemic from round about January the 10th.
Thank you. You say, it's on the second page of the page we have here in the second paragraph, there are some instructive parallels with the H1N1 pandemic in 2009 to 10. Indeed, one possibility is that this could turn out to be quite similar in some key respects, a widespread epidemic fueled by mild cases, but with mortality among vulnerable patients. Can you tell us why it was that you were seeking to draw to Dr. Calderwood's attention parallels with the 2009-10 H1N1 pandemic and the various features which you identified as being a possibility of the pandemic which you were predicting for the novel coronavirus at that time?
I think that was the most instructive parallel available. And it wasn't just the characteristics of the infection, which, as the inquiry has heard a lot of evidence for, turned out to be significantly different from influenza, but also the nature of the response. And I had been involved in the Scottish response to the H1N1 pandemic in 2009. And there were deficiencies in the response at that time, and I was very anxious that history didn't repeat itself.
Yes, I think we'll get to that very expression that you used in one of these messages. But what was it about the information that you had that suggested that it would be an epidemic fueled by mild cases with mortality amongst vulnerable patients?
It's a respiratory infection, and that's pretty standard textbook expectation for a respiratory infection.
As far as the ability to detect the spread and therefore significance of the virus, what is the significance of the fact that it would be fueled by mild cases?
That simply means that it would be very difficult to track by detecting people reporting with symptoms. You wouldn't see a lot of the cases, so you would need other ways of identifying those cases. Because they wouldn't know they were cases.
Yes, so people would have mild symptoms that they wouldn't necessarily associate as anything out of the ordinary, and therefore might not report for testing, such that chains of transmission might go undetected. Is that the broad idea?
Yes, and as you may want to discuss later, that turned out to be a huge problem.
Yes, indeed. At the moment, I'm focusing on what it was you were predicting. You are also predicting mortality amongst vulnerable patients as being a feature of a respiratory virus of this nature based on your extensive experience.
Yeah.
You say, although in that paragraph you are pitching your prediction as a possibility, in the previous paragraph, based on the not unexpected announcement, as you've explained, of human-to-human transmission, you state that this will become a pandemic and therefore will affect Scotland. That was your position at the time?
Yes.
And that was why you wanted to bring this to the attention of the Scottish Government through the Chief Medical Officer?
Absolutely.
Thank you. Could I just then go to the next paragraph where you highlight, in light of your predictions and the particular features of the prediction you're making, what it is you think will need to be done to try to cope with this. You say such an epidemic would be difficult to track. As in 2009-10, what would be needed is an integrated surveillance setup that combines clinical surveillance, genomic surveillance, and serological surveillance, the latter requiring an appropriate test. We, and I am sure many others, are working on this already. This should be unexceptionable. My reason for writing now is to emphasise that based on experience of 2009-10, that system needs to be put in place in advance of the arrival of the virus, so the sooner the better. If we wait until after the virus has arrived, then we will miss information of public health value, and our efforts to prevent the control of the pandemic will be compromised. So the message you were trying to convey was based on your previous experience of what you considered to be similar viral outbreaks. One needed to act fast in order to try to keep the spread under control.
Correct.
Can you help us a little bit with the requirement for clinical surveillance, genomic surveillance, and serological surveillance? What would those different components have been aimed towards achieving?
So I'm actually taking this straight from what my team did in 2009, 2010 on behalf of the Scottish Government. They asked us to do this eventually, and that's the work that we did. There is a clinical surveillance system, not just in Scotland, but more widely, for influenza-like illnesses, respiratory infections, essentially. That's useful, but what we'd found in 2009 was it wasn't extensive enough. And what we were able to do, working with colleagues in Health Protection Scotland, was get that role. It's based around general practices, and we got that scaled up very quickly, and that provided very useful information quickly during 2009. Genomic surveillance, well, I don't know how much evidence the inquiry's heard about the value of whole genome sequencing. It wasn't something that Scotland actually was geared up to do in 2009. So, again, my team, we had to introduce that. It was relatively new technology at the time. We had to introduce that into the process, and that was extraordinarily valuable, just as it was with COVID-19, but not nearly as advanced at that time. And serological surveillance, and that's, again, what we did in 2009. It's basically detecting people who have antibodies to infection. So it's tracking an infection by taking blood samples and detecting who has had the infection. So it's not the same as the PCR tests and the lateral flow tests that came along with COVID. In this, I didn't anticipate those, but it was a very useful tool in 2009, this serological surveillance.
And obviously, as you said, you were seeking to convey a sense of urgency about the need to create these systems and develop these systems specific to COVID. What was your understanding of Scotland's ability to do that at that point?
So prior to this chain of emails, I'd been in touch with my colleague Chris Robertson at Health Protection Scotland, and through him with Jim McMenamin, who I believe you've already heard from.
That's right.
And so I was getting a sense of what level of activity was going on in Scotland, and I didn't get the impression that it was, in my view, treating the situation with the seriousness or the urgency that I felt it needed.
I see. So did that apply simply to the reaction to the information that was emerging, but also to the practical requirements that you were recommending needed to be put in place in order to deal with that threat?
Yes. So in a perfect world, I would, in this email, be pushing at an open door. And the reply I would get to that email was, "Thank you, Professor Woolhouse, we're already doing this." And I believe you heard from Gregor Smith earlier, and I watched his testimony, and he said, and I'm paraphrasing slightly, "Professor Woolhouse is just telling us textbook stuff." We know this. And he's absolutely right.
Right.
I was. But the textbook stuff needs to be acted on.
Yes.
And the thing that I was particularly concerned about was, although I'm very well aware of all the systems in place in Scotland and elsewhere to respond to an outbreak, including an influenza outbreak, I was already convinced at this early stage that this was going to be considerably worse. And so I was really trying to push this. But I would have been very happy with the response to this email saying, thank you, we are already doing this.
Right. And you say this was your impression. I think from various materials, including your book, you were also in contact with other people in the UK at this time. You've mentioned Chris Robertson, you mention Neil Ferguson, Jeremy Farrar, and others, some in Scotland, I think, with whom you were discussing these matters around this time. Were they of a similar view to you? Was there a consensus?
Oh yes, absolutely, absolutely, no question. We were all very concerned
yes.
At this point. All those people you've mentioned there.
So lest it be suggested that this was simply your view, this was a view which you had discussed and developed along with other experts in the field.
Yes.
You say in your statement at paragraph 186 that better surveillance coupled with genomic studies would have facilitated better advice and better decision-making during this crucial period. Had these systems been ramped up in late January and into February, as you had advocated, would this have been early enough to allow for the spread of the virus to have been restricted more than it was before the lockdown was imposed eventually in March?
Yes, so I'm suggesting a programme of gathering data, gathering information. There's a whole, obviously, another rather important layer of what you then do on the basis of that information. But obviously, if we have better information, we are better informed, we can make better decisions, which might well have the consequence that you outlined. But I'm here concerned with getting the information.
Of course. There is a theme, I think, which we've discussed with some other witnesses that runs throughout the testimony and the many documents you've provided, which is a frustration which I think you held and predated this period, and indeed had been the subject of some correspondence with Dr. Calderwood in the years prior to this, about the lack of data access for those like yourself in the research community in order to be able to provide the level of assistance, support, input that you would have liked to have provided in a situation like this. Could you tell us what the background to that was broadly, and whether these frustrations remained active at this time?
Well, the second point, the answer is a simple yes. The first point, that emerges again from experience in Scotland of 2009-2010 influenza. And you mentioned I was a fellow of the Royal Society of Edinburgh. We did a post hoc report of the management of that incident in Scotland, and we made a series of recommendations precisely about this, that we needed to have the mechanisms of obtaining, sharing and analysing data in place, ready to go should another pandemic arise. Quite a detailed report. And I already was aware that this report had not really been acted on, so that's one of the things about my frustration. What I wanted to know, what I wanted to happen here, me and others through the Royal Society of Edinburgh had recommended over 10 years ago. No, not quite 10 years, sorry, 2011, 12. So
right.
Getting on for 10 years ago.
Right.
And it hadn't happened, hence the frustration.
I see. We heard some evidence from other witnesses, including we heard evidence together from two Health Protection Scotland witnesses. You mentioned Dr. McMenamin, I think, and we also heard from Professor Nick Finn, who spoke, although he wasn't in Scotland at this time, spoke on behalf of Health Protection Scotland. And when they described their attitudes over this period, both, if I recall correctly, were keen to emphasise that the previous swine flu experience was a substantial factor in their thinking about the threat, but perhaps in the opposite way to the way in which you were using your experience of previous viral outbreaks. You were drawing on your previous experience, which led to you, I think, suggesting this was a significant threat, whereas it seemed that their evidence was to the effect that the swine flu outbreak was something that was making them more cautious about coming to the conclusion that this was a significant threat. I wonder if you could comment on that and whether the attitude, as I've characterised it from them, was a prevalent one at the time?
It was, and the reason is fairly straightforward, actually. In the swine flu turned out to be, by the standards of these respiratory infections, really quite benign. Its case fatality rate, the fraction of people who are infected and die, was somewhere in the order of 1 in 1,000, which is low. I mean, obviously it's significant. It's a public health problem and needed to be managed, but it's relatively low. The early estimates of the infection fatality rate for this virus were, I think that comes later in this email chain, somewhere in the order of 4%. Mm-hmm. Well, that's 40 times higher. So you can immediately see that this potentially then is going to be an enormously greater event. The reason why I personally, unlike my colleagues you've mentioned, leant towards the more concerning or alarming figure, because we knew, again, going back from certainly the first half of January, well before this, from genome sequencing studies done on material from China, that this virus was extremely close related to the SARS-1 coronavirus. That had a case fatality rate of 10%.
Right.
So from my point of view, we're in this territory. This is a very, very similar virus to something that had a case fatality rate of 10%. That's a completely different magnitude of problem than swine flu.
Yes.
That's why I was
so you are bringing together, I think it's fair to say, a number of different experiences of previous viral threats, swine flu, H1N1, and the information that you had, the original SARS, as you've just outlined, with its high infection fatality rate. Your view, bringing all of this evidence together, was not that there was evidence suggesting that this was not a matter for concern, very much the opposite. It was a matter of significant concern.
Very much the opposite, yeah.
Okay, thank you. You mention in your email the possibility that there could be mortality amongst vulnerable patients. We've heard significant evidence in this and other modules about the fact that Scotland, relative to other parts of the United Kingdom, had a relatively elderly population with significant health inequalities and comorbidities. Was it therefore all the more necessary, given this possibility of mortality against that background, to start to consider doing something to protect that large cohort of vulnerable patients in Scotland?
Yes. I wouldn't want to overstate my level of understanding of the situation at this very early stage. And there still wasn't good evidence as to what a vulnerable patient was for this. There were indications from previous experiences with SARS and indeed influenza, so we had some idea, but this was all quite uncertain at that stage. But that, as I said, seemed to be the most likely course this would take.
But if that possibility did eventuate, that would be a particular problem for the particular characteristics of Scottish society, given the pre-existing.
I would not pretend to you that I was thinking at the time that Scotland was particularly vulnerable to this. Just that Scotland was vulnerable to this. Full stop.
Did that start to become part of your thinking over the subsequent months?
Yes. It depends what you compare Scotland with, but
yes.
The vulnerabilities of one thing. The main vulnerability, as you well know, is age. So the very fact that the whole UK population is actually quite elderly by global standards was a concern.
Yes, indeed. Thank you. The number of these emails, if we could scroll up through the emails, we can see the reply. Scroll backwards, if you like, through the emails. You can see the reply from Dr. Calderwood, where broadly she says to you that she acknowledges your email and I think tells you that PHE and HPS, as it was at that time, before the advent of PHS, were actively considering the detailed surveillance needs and investigation required for this novel virus. and apparently recognising the value of those surveillance systems. How did you take that response? Were you satisfied that it sounded like they had things under control, or were you expecting a little more given what you had said in your earlier email?
I don't regard actively considering as sufficient.
Thank you. If we go again back through the previous emails, we're going to one on page 4, which is dated the 25th of January. And you say, you write to Dr. Calderwood again, and you indicate there that you have discussed the matter with a number of others, including Jeremy Farrar, Neil Ferguson, as I said, and that they had independently reached the same conclusions and have advised Chris Whitty accordingly. You provide some further information and then state that based on the case fatality rate, I think the infection fatality or case fatality rate you mentioned a moment ago of 4%, if you were to put those numbers into an epidemiological model for Scotland and many other countries, you would likely predict that over about a year, at least half the population will become infected. The gross mortality rate will triple more at the epidemic peak, and the health system will become completely overwhelmed. We can formalise those predictions, and there are many caveats to them, but those are the ballpark numbers based on information from the WHO. Please note, this is not a worst-case scenario. This is based on WHO's central estimates and currently available evidence. The worst-case scenario is considerably worse. Again, what were you trying to convey to Dr. Calderwood again about your developing understanding, your conversations with others, and information that seems to have developed in the days since you last wrote a few days before?
Yes. So the work that the actual science that we've started to do is at this stage, at this early stage, is trying to understand, in context of my team's work, the scale of the threat to Scotland. And I'm reporting on what we now assess the scale of the threat to Scotland to be.
Yes. And you in a couple of lines down, you say, your reply to my earlier email did not give any indication that here in Scotland we're preparing for an R02 CF 0.04 event, and I don't have the sense that we are from my networks here either. So I think they are conveying the information that the case fatality rate is 4%, as you said earlier, which is an alarming case fatality rate. Is that right?
Correct.
And that the R being 2, that is the R 0 of the virus, which is an indicator of its transmissibility. Is that correct?
Yes, and actually that one turned out to be an underestimate. So
yeah, indeed. but even with those numbers,
yes.
You are expressing there, as you've told us in your evidence, a degree of dissatisfaction with the level of the urgency within Scottish Government.
Yes, and again we come back to Gregor's comment that this is textbook. Yeah, it's textbook. My undergraduates could do this calculation.
Yes.
My undergraduates could come up with this assessment. This is not difficult.
Yeah. Well, one might say that makes the lack of action all the more questionable and perhaps culpable.
I think I better leave that to the inquiry.
Okay, thank you. But in any event, you were, as I say, trying to convey, applying basic epidemiology, if that's correct, to the specific characteristics that had emerged from the science, the R0 and the case fatality rate. To you, it was fairly obvious that this was going to be a huge problem.
Yes, and you mentioned the book I wrote. One of the things I put in that as the final explanation in my mind for why this wasn't landing in Scotland or elsewhere was you put all this very, as I say, fairly basic information together, and what you get is an unfolding catastrophe. And I think a lot of people simply couldn't get their heads around that.
Right.
Even though, as I say, this is very simple.
Mm-hmm.
So you add this number and this number and this number and this number, and you get a catastrophe. I think they couldn't take that final step.
Yes.
Put all this information together and what's going to happen. And of course...
Are you, I think, therefore, you're attributing to the medical advisors of the government at least the ability to do the basic epidemiology and arithmetic. But are you suggesting that perhaps, given the number that came up with, they rather froze?
Yes.
Thank you. Could we look at go further back to page 2, please? This is a further email which you sent on the 26th of January, so that the very next day. Just while we're getting that, one thing that was mentioned yesterday by Professor Sridhar that I just wanted to ask you about, a couple of things about the way in which information is communicated to people like yourself. She mentioned something called PubMed, which, as I understand it, is a source of information about developing epidemics or developing viral threats. Is that right? ProMed. ProMed.
Yes.
And could you just tell us a little bit about what that is and the extent to which that was used by you and others to be able to access information about the emerging virus?
It's been around a while. I don't know quite what you call it. Maybe something a bit like a blog, but it predates even blogs. So it's a loose association of experts in the field who report to one another concerning events to deal with infections, right. Of which in a given year there will be dozens, if not hundreds, around the world. And that I'm inferring that Devi used this as one of the sources of information. I actually didn't use that one.
Right, okay. And we've also heard some evidence from a number of the witnesses who have helpfully provided our Rule 9 responses of, not necessarily at this period, but in the period after this, as information started to emerge more about the use of preprints in analysing the emergence of the threat. Could you tell us what that is and the extent to which that was used in trying to understand what the threat was and the characteristics of the virus, etc.?
Yes, the gold standard for communicating scientific knowledge, of course, is the publication of a piece of research in a scientific journal, which is done subject to peer review. So it's looked at by experts, it's judged to be sound, and it's published. And that remains the gold standard. But in a very fast-moving situation like this, that whole process, well, I mean, quite frankly, it can take up to a year sometimes, and for some circumstances longer. So it's clearly far too slow. So preprints is the practice of taking the paper that you've submitted or you're planning to submit, but publishing it immediately. And it's made very clear on the preprint servers that this is not peer-reviewed research. So for that reason, it hasn't been quality controlled, but it's put out there so that the rest of the scientific community can see it. So it's basically a very fast way of communicating your research outputs, but it loses the quality control element of peer review.
Thank you. The reason I've asked you those questions, Professor, is that a number of other people, including the PHS representatives, suggested that the way in which evidence emerged over these early months, if we put it that broadly, from January onwards, about the nature of the virus and hence the nature of the threat, was unreliable or contradictory or difficult to interpret. It doesn't seem to be the case, even at this very early stage, and in fact you've referred to you developing views about this even earlier than this correspondence, that you, although no doubt are taking that into consideration, the reliability of the evidence, that is restricting you from reaching the conclusion that this is a very, very significant problem about to happen. Could you tell us about why it is that you felt confident enough in your professional assessment to be able to express these views despite those concerns expressed by others?
Well, one very simple way to do it is if somebody from, whether it's a scientist from China or the UK or anything, is publishing, wants to publish a paper, something they put up as a preprint. Beyond the preprint, someone would have to peer review it. That person would quite likely be me.
Right.
So I felt perfectly qualified to peer review the evidence I was seeing myself.
Yeah. So you were able to evaluate what was in the peer review and use your extensive experience to be able to reach a judgment about whether this was reliable and sufficiently reliable information to be able to communicate these sorts of messages to government.
Yes, and during the pandemic, I didn't have time to do this for the scientific journals, but it's a job I routinely do for scientific journals. So I was simply doing it in real time in a different context.
Thank you very much. In this message, you go back again, as we said, this was the next day, and then you set out a number of different scenarios. Could we just scroll down a little bit further than that? There was one aspect of this where, just a little bit further than that, thanks, it's where you get to the measures we could consider are. You talk there about a vaccine being a part of the solution, I think. And what at that stage would you have been thinking? Obviously, a vaccine would have been a very useful thing to have, but in terms of planning, what would your realistic expectations have been about when a vaccine might become available based on your extensive previous experience?
At that time, I think the fastest a vaccine had ever been rolled out from scratch was 4 years previously. Obviously, there was going to be a great need to accelerate the process. I really got that estimate of a year through correspondence that you already mentioned, particularly with Jeremy Farrar, who's director of Wellcome Trust and is very, very well connected with the vaccine manufacturing base. So, I agreed with Jeremy, but I think his estimate was much more authoritative than mine, and that was.
So you just scroll down a little bit further. You mentioned antivirals there. Again, you say effectively that's something for the time being at least we're going to have to live without. So I think you're then pointing towards the need for what I think are non-pharmaceutical interventions in order to try and deal with the situation. And you mentioned there a number of different things with which we subsequently became familiar: case isolation, infection control, and contact tracing, social distancing. But also the thing I wanted to focus in on particularly was public messaging. What was it that you thought, you rather there suggest you hoped that the government was already doing something about that, but what sorts of public messages do you think should have been emanated, been sent out from that time onwards in order to try to manage the balance required between not causing widespread panic, but allowing citizens to be part of a bond of confidence with government about how their own health and safety is being managed?
You summed it up perfectly. That's exactly what I was worried about.
Right. So you think that there required to be some level of public messaging that reflected the need to balance those two considerations?
Yes, and I was doing, as part of my role at the university, a good deal of media work, even at that stage, and I was having to walk this tightrope myself. And it would have been very helpful if the Scottish Government had actually made some pronouncements that could then be discussed by the media and commentators and so on. So I was tiptoeing around exactly the problem that you identified.
I see. But is it correct to say, because this is one of the things identified here, that a level of engagement of the public appropriately pitched was necessary?
Yes, but I wanted it to come from government. Obviously one thing I could have said in media interviews at that stage was what's in these emails.
Yes. Yeah.
For rather obvious reasons, I did not want to do that. That should not come from me.
Absolutely.
But it wasn't coming from anyone else. Well, that was the problem.
You were, I assume, speaking to the very person in these emails from whom you thought it should be coming,
yes.
the chief medical officer and the ministers whom she advised.
Yes.
There was then an exchange of emails, further emails, where you provided more information. Just for the sake of the record, the 31st of January email is INQ 000103352. And then in a further email, which we've seen, which is INQ 000103215, we've seen an email which was sent, not involving you, but it was sent by Dame Sally Davis, who I understand was the former Chief Medical Officer to the UK government, to Dr. Calderwood on the 5th of February, in which Dame Sally Davis oddly introduces you to Dr. Calderwood. Was that email the result of some contact you had with Dame Sally Davis about the position?
Yes. So we've discussed my frustration with what I continue to perceive as the lack of action. So I'm surprised you don't have the email, but maybe you have it somewhere else. I wrote to Sally, who I knew. And the email's there somewhere, but I'm paraphrasing slightly, is I'm saying, Sally, can you get Catherine to listen to me? Because she's not listening.
Okay, thank you. And I think, again, if we have a series of emails here, again, all joined together under this reference. If we scroll up, there's a reply on the 6th of February to that message. You're copied into these messages, I should say, in which indicating that you had emails in the very recent past with some extremely helpful modelling estimates, she says to you, as you're CC'd in, let's find a time to meet face to face. You eventually did have a meeting with her, I think, but on the 28th of February, is that right?
Yes, that's correct.
Again, did that timescale between your original contact, the need to try to engage the assistance of Dame Sally, and the date of the eventual meeting, give you the impression that Dr. Calderwood was taking on board the level of the threat that you were trying to communicate?
I was less concerned about the actual meeting at that stage. What I hoped that Sally Davis's intervention had done would be suggest to the CMO that it might be perhaps wise to revisit my advice and what I've been telling her and take action accordingly. So I didn't push for that second meeting. I left that to the CMO's Scotland.
I see. Could I just run through some of the things that I understood happened roughly between the time of this email and the eventual meeting on the 28th? Just there, in order to try and get some key indicators of the developing knowledge of things that seem to us to be significant in the elevation of the threat. A meeting of SAGE took place on the 4th of February, in which it stated, on the basis of their analysis, that asymptomatic transmission cannot be ruled out and transmission from mildly symptomatic individuals is likely. It also indicated that human-to-human transmission outside China had occurred. Now, obviously, you've given us a lot of information across the various modules about the significance of asymptomatic or mild transmission. You had, in fact, predicted that it was at least a possibility sometime before that this would be the type of virus which could be transmitted by mild patients, and you've explained to us the significance of that. As at that SAGE meeting of the 4th of February, what was your view about the reliability of the evidence base that the virus was going to be transmitted by either asymptomatic, pre-symptomatic, or mildly symptomatic patients?
Thank you for mentioning pre-symptomatic, because it's very, very important on this. But the data on this was emerging in a very piecemeal way from China at the time. And me and many other epidemiologists around the world were trying to make sense of this data. I had a slight inbuilt advantage in that in my research group at the time I had two very able Chinese students who were very useful in giving me intelligence and guidance as to what was going on in China and how we should interpret the sorts of information that was emerging. But China, and I believe the WHO, were at the time actively suggesting there was not much undetected cases, mild cases, that this was not the pattern. It was completely wrong, but that's what they were suggesting at the time. So this created a lot of doubt.
It might be difficult to know how many undetected cases there were because the mild asymptomatic or pre-symptomatic spread means it's hard to detect them.
Yeah, but they did surveys, but they didn't interpret the results the way I interpreted the results.
Yes. So at what point over this period, did the evidence base, which, as you say, was not entirely satisfactory, although you had the advantage of two able Chinese students assisting you, at what point over this period did it become apparent to you, based on the kind of judgment that you have explained you apply to evidence and papers, that asymptomatic, pre-symptomatic, or mild transmission was going to be a likely feature of this particular epidemic?
I don't think the evidence for that became firm, the sort of evidence you would publish in a scientific journal for quite some time. I think that don't think that happened in February.
But it was definitely part of the thinking.
Oh yes. Oh no, it was absolutely part of the thinking.
Time.
We were concerned, but again, the evidence hadn't emerged. There were systems set up which Scotland was involved in. An exercise called the First Few Hundred. Mm-hmm. I think you've heard of that.
Yes.
And that was designed to provide, among other things, this sort of information. But of course, in order to activate something called the First Few Hundred cases, you have to have 100 cases here in the UK or in Scotland or wherever. And we were nowhere near that number.
Yes,
stage.
of course. Well, as far as testing is concerned, that was something else I was going to ask you about. The earliest record that we have of tests being conducted in Scotland is, I think, around the 10th of February. But when was it that a test in its most basic form, if you like, was available?
Wouldn't have been long before that. I don't think that's. I don't think there's any. I don't have any concerns about that.
Yes.
I think that first test date was pretty good.
Yes. We know that because there were 57 tests conducted that day. All were negative, so we're not contributing to positive tests. Yes,
but the principle was established, and I'm glad it was. That was a welcome development.
Absolutely, thank you. You met again, Dr. Calderwood on the 28th of February. We have a briefing note, which is INQ 000103216. This is a note, I think, that you sent her in advance of the meeting. Further down towards the end, you sent her a lengthy analysis of the position as at that date, as things have developed since your initial correspondence. And then a bit further down, thanks. Yeah, you say there are two scenarios we particularly want to avoid: doing nothing, as that is likely to result in the health system being overwhelmed in a matter of weeks once an epidemic takes off; implementing extreme social distancing measures that, sooner or later, have to be relaxed; and then, having already paid a high social and economic cost, experiencing a delayed epidemic that still overwhelms the health system. So there's a degree of balancing, I think, required there as well. What was it you were trying to urge in advance of your meeting in this lengthy, detailed briefing note what were you trying to urge upon Dr. Calderwood as important things to bear in mind in this overall scenario assessment?
Yeah, exactly what I say there. I mean, it was clear to me at that stage that we were going to have to walk a tightrope between an epidemic that took off, basically, and overwhelmed the health service, or wasn't thinking of lockdown in those stages, but at that date, but some very severe social distancing restrictions that would be extremely damaging in their own right. We were walking between two very, very unsatisfactory outcomes. So this was going to be difficult.
Yes. What was your view at this point, towards the end of February, about what Scotland could have done in order to try to handle the threat as it was at that point?
Well, we started to discuss this in the meeting. I think it's the next day after this. So it's I don't know if I say it in using that phrase in that meeting, but one of the things we've been working on there was this idea that earlier intervention can be less drastic intervention. So if you want to avoid these very severe social distancing measures, then actually you're going to have to go intervene earlier. But I'm not sure I was quite at that stage in my thinking at this meeting. I think that maybe emerged. First time I did a briefing on that, and I remember that one was March 4th.
Right.
So I may have mentioned it to Catherine
yes.
at that meeting. It was certainly in my mind,
yes.
But I don't think we'd actually written it up. That earlier intervention can be less drastic intervention.
There's some other email correspondence that we've seen. We could take that one down there. Thank you very much. Some other correspondence relating to the meeting, slightly after the meeting, in which one of the things that you refer to is social distancing measures were very likely to need to be introduced in Scotland, possibly very soon. In your statement, you say that meant days, not weeks. And you also point out that there would be a need for a clear exit strategy. And also some level of analysis of the effect of social distancing economically, socially, and psychologically. So you're setting this out presumably at or immediately after the meeting. Could we just look at those different components at that stage as far as the measures that were concerned? What did you think needed to be done? The second was the exit strategy, and the third was some level of analysis of the effect of social distancing measures emotionally, economically, socially, and psychologically. If you could explain the significance of those and your position at the time.
Yeah, so it is, as you said, I'm setting out the need to balance harms. And this is absolutely fundamental to public health. In public health, you're always balancing harms, even if the harms are just monetary costs. But it's always a balance you're trying to strike. My concern here, and this comes back to the scale of the crisis that didn't seem to be landing in government at that stage, is both harms, the harms that the virus could cause and the harms that the countermeasures could cause, were immense. Mm-hmm. They were absolutely enormous. So when I'd been doing this sort of exercise over the years of trying to make an intervention, a health intervention, efficient, so not too costly, not damaging other ways, the stakes were nowhere near as high. Mm-hmm. There's a little bit of wiggle room. I mean, you get it wrong this way a bit or that way a bit, and it costs the government a small amount of extra money. But here, the stakes are absolutely enormous, mm-hmm. and we have to find the right path. Mm-hmm. If we go too hard or too soft, we're going to end up paying an enormous penalty. And this is very obvious to me. Well, as you saw from during late February, that we were in this position. Mm-hmm. So I'm trying to lay the ground for this sort of decision making that's going to have to happen. Yes, if we're not and damage.
And I think you tell us, or these documents show that you are not aware of any. You're talking about the other side of the balance, if you like. We've heard something which we'll come on to later, which the Scottish Government introduced after this in April, that we call the 4 harms strategy. The first harm being the harm of COVID itself. The other harms being harms caused by the measures taken to combat COVID, the non-COVID health harms, the societal harms, and the economic harms. Is it your understanding that at this stage within Scottish Government, no analysis had been done of the effect of even the social distancing measures short of lockdown, which you were suggesting might be contemplated?
None at all, as far as I'm aware.
Okay. The other element of what we discussed there was the exit strategy. Why was it important to have an exit strategy?
Simply because the sorts of interventions, the social distancing that were being contemplated at that stage were clear, and that include things like school closures that were on the table, were clearly very, very harmful. And equally clear, they could not be implemented indefinitely. We couldn't, well, it turned out to be a lockdown in the end. We couldn't lock down indefinitely. So the lockdown had to come to an end. So what would be the strategy, the exit strategy? What would make you decide that you could exit lockdown? And the reason that's important is because the exit strategy is going to also determine how long the lockdown is. So what are we preparing for? So you could imagine that came up later, the sort of circuit breaker type approach where actually the lockdown is just a week or something, or all the way up to an indefinite lockdown until we got a vaccine. So there's a range of possibilities. So and it's very difficult to advise on what the best strategy is unless you know what the government is willing to contemplate. I mean, can I give you a very simple example?
Absolutely, very helpful.
If the government was willing to contemplate an indefinite lockdown, and forget all the costs and the harms that would do, but that they were willing to do that, then my advice would be, right, do it now. Lockdown now. That's the way to minimise the impact. But obviously they can't do that. We'd be locked down for possibly years if we'd done that. It's completely impossible. So as soon as you accept that the lockdown has to come to an end, then the question arises, well, then when is the best time to do it? And suddenly you're in a different space. The decision is no longer nearly so easy. And the reason this is causing us all such concern at that time, and there was a lot of work going on about the best timing and duration of what turned out to be a lockdown should be, so the severity of the intervention as well, is because it hadn't been done before. Because we'd never contemplated lockdown as a public health policy at all. This was completely new. We ourselves, I mean, you kindly call me an expert in the field, but I've never thought about this before. Never contemplated it. So I got my team frantically working. How is this going to work? What's it going to look like? How long should it be? When should it be implemented? What's the exit strategy? We're working very, very hard to try and understand something that, if we'd known it was going to be on the table, we would have spent years researching before, so that we understood all the nuances and all the trade-offs and how actually you should do it. But none of that work had been done because no one around the world had ever contemplated lockdown. So we were frantically trying to catch up.
Which explains why I think that your correspondence at this time isn't referring to lockdown or anything like it. It's referring to social distancing measures, or even more extreme social distancing measures, because lockdown simply was not part of the narrative and had never been prepared for.
No, so of course it was on the radar because at that stage the city of Wuhan had been locked down.
Yes.
Obviously we were very aware of that and that had been widely discussed. But I think the realisation that something like a lockdown would have to be contemplated for Scotland took rather longer.
Right.
And,
did you have the impression over this period and up to the point at which the lockdown actually occurred that there was any clear exit strategy in the mind of the Scottish Government?
In the end, when we went into lockdown, I don't think they had the faintest idea how long we would be in it for.
And as regards the matters we discussed, the systematic analysis of the effect of the lockdown or social distancing measures economically, socially or psychologically, did you have any impression that any such assessment had been done within Scottish Government?
Absolutely none.
You met with Dr. Calderwood again on the 6th of March, and there is another email follow-up in the same way as you'd done on the previous one, summarising your position. That there's one element of this advice at this stage that I'd like to just draw your attention to, specifically to ask you some questions about. You see there are 3 social distancing measures informed by the modelling work of Imperial College and communicated through SPIM. It's the third one I was interested in asking you about. If you could explain what one of the things that you're suggesting is that there should be a policy of cocooning populations about the age threshold that you've mentioned. What is cocooning, and why was it part of the strategy that you were proposing might be contemplated by the Scottish Government at this time?
So our understanding has developed considerably by this stage. You pointed to my January 21st email where I identified that there would be likely to be a subpopulation of very vulnerable people. We now had very good data that there was tremendous variation in the risk with age. So the idea then is, well, how do you protect people who are very vulnerable? This seems to me, I have to say, to be actually the absolute number one public health priority for Scotland and everyone else. We've identified a subset of the population that's at very considerable risk. We spoke about the case fatality rate, and we said that a case fatality rate of 4% was high. But in the elderly and the frail, it's way higher than that. So these people are very, very vulnerable. So how do we protect them? And I hadn't thought of this concept of shielding as it eventually was introduced, which is basically asking a lot of people in the community to protect themselves. So we had this idea of actually protecting people by protecting the people around them. So carers, family members, same household, that we had to pay particular attention to this. So that's what I was proposing, and that's an idea that we went on to develop.
So cocooning then is protecting not only those vulnerable people, but the people who would be likely to engage with those vulnerable people, their carers and so on. Is that right?
Yes, likely, but not through choice, but through necessity. Because elderly people, but particularly, of course, elderly people with other risk factors, other comorbidities, need care, whether it's in the home or it's in a care home, or even some in hospital. That this is a subset of the population that really couldn't socially distance. It's just not possible. They can't.
Yes.
So clearly that wasn't going to be, unfortunately, was the strategy that was implemented, but just telling people to isolate themselves. But it seemed to me that we needed to actually, we couldn't isolate themselves, so that wasn't going to work. So how do we do it? And we do it by cocooning.
Yes, I see. Was cocooning a policy which ever formed part of the Scottish Government's response to the pandemic?
No, and that wouldn't have mattered had somebody, there's a lot of very smart people thinking about this problem, come up with a better way of protecting the vulnerable population. But what we got was shielding in the form that it was introduced in Scotland, which in the community anyway was basically telling people to cut all contacts out, which there's lots of evidence now that didn't work particularly well, and I can give you chapter and verse as to why it didn't work if you want. But yeah, that didn't seem to me, even at this stage, to be a very good approach.
Thank you. There's a comment there as well, just on this particular suggestion that Gregor, who I'm assuming is the now Chief Medical Officer, raised the point that there might be vulnerable people below the chosen age threshold as well. Personally, you're right, I don't see any reason why risk factors other than age couldn't be included in a cocooning policy, but as for the clinicians to advise what those might be. So you've obviously identified age as the main risk factor on the evidence that you've seen, which of course turned out to be absolutely right. But there's a suggestion made by the then Deputy Chief Medical Officer that we might need to consider our other groups vulnerable to the virus as well, and you are open-minded about the possibility of doing that because you recognise that there might be such groups who could be protected by similar mechanisms.
Correct.
Thank you. Could we just go down, have the whole email up as well, please? Over the page, I think. Yes, do you conclude this email by saying one final point, perhaps the most important of all? A lot of work went into making containment work, quite rightly, but it hasn't, as was to be expected. A lot of work is now going into making delay work, quite rightly. It may work or partially work, but there remains every likelihood that it won't work well enough to prevent an epidemic that does sooner or later completely overwhelm our health systems. This is not a prediction, but it is an entirely possible scenario. If it happens, it could happen within weeks, so I do think that we should start thinking about the mitigation phase now. Can you summarise for us what you were trying to convey as to the strategy at this stage, what needed to be borne in mind as strategies started to be put in place in the weeks after this?
Yes, so the UK government had this strategy, containment, delay. There was a research arm, which is a little bit of a diversion. So containment, delay and mitigation. And this was, Chris Whitty, I think, was...
Yes, I think it was part of the UK Coronavirus Action Plan that was launched on the 3rd of March, to which the Scottish Government also subscribed.
Thank you. You're right. So I'm now trying to tailor my comments to fit in with the actual plan. I mean, there is now a plan, so that's progress. But I'm trying to tailor my comments to fit in with that plan. But I don't think that plan is going to work.
Yes. And what is it that you are counselling particularly about the dangers that plan might not work?
Well, I mean, what I'm saying is quite clearly that we should start thinking about mitigation, which is basically, okay, how do we deal with the fact that we're actually going to have an epidemic? We haven't contained it. We've delayed it as long as we can, and here we are. We have a pandemic. What are we going to do?
Did you understand over this period, did you take the Chief Medical Officer and other medical advisors to the Scottish Government with whom you were speaking to be receptive to your advice in the period from January up till the first lockdown, or not?
Well, we've discussed the difficulties I had getting myself heard up until February, so I think the only answer I can give you is no, I wasn't. I feel it did change, the tone did change in March, and that coincides with Gregor Smith getting more actively involved in the discussions I'm having with Catherine Calderwood And I think that the pace did pick up, certainly in the first week in March.
Was Gregor Smith then considerably involved in the planning as far as you're concerned around that time? It wasn't simply Dr. Calderwood.
I don't know. I'm simply referring to his involvement
With you.
in the correspondence with me.
Yes.
And he was starting to ask questions that were the sort of questions I would,
Yes,
wanted to be
we've
asked.
heard evidence from him, for example, that he attended a number of the early SAGE meetings as an observer where he was gathering information, and he was obviously then part of the discussions with you.
Yes, but I mean, we've discussed before here that I don't think, and many other people think, that those early SAGE meetings were particularly doing a good job of raising the alarm.
Thank you. After this, you, of course, were attending SPIMO, and you communicated, I think, some messages with information about what had happened at those meetings in early March to Dr. Calderwood and Dr. Smith. Is that right?
I did. So this became a modus operandi for us, that I would brief the pair of them on the outputs of SPIMO. And I think that was important. There were, as you well know, there were many sources of information coming in, but in terms of the sorts of questions that needed to be tackled then, SPIMO was absolutely the repository of expertise and knowledge. And so I think it was, I felt it was important that they were fully appraised of what SPIMO's thinking was.
Okay. We've discussed the absence of certain features of the Scottish Government strategy before the first lockdown, but in that regard, what was your understanding at this time within the Scottish Government of their planning with regard to the way in which Scotland might deal with a second wave of the virus were it to eventuate?
I gave in my briefings that we've been discussing to Catherine Calderwood, so this is, well, I think actually some of it is even before we had cases in Scotland, but we have some idea of the sorts of social distancing intervention we might need. I said then that we were going to get, well, no, not that we're going to get, as you well know, I don't do that, but we were very likely to get, should plan for, the possibility of a second wave. And do you want me to give the reasons for that?
Yes, please, yes.
Right. The reasons for that is I was acutely aware that lockdown, or any combination of social distancing measures up to and including lockdown, would not solve the problem. All they would do was delay the problem. And the first manifestation of that delay is, okay, you get another wave. Mm-hmm. And then you push that, and I shared this scenario with them. You push that one down, the second wave, which, as it happens, in the briefings I gave, was September 2020, the second wave, so pretty close. And you quash that one down, and then you get another one in the early part of the next year. Now, there's no way you can predict with any precision how something like this is going to unfold over such a long timetable. So we wrote in very big letters on our graphs and briefings on this, this is an illustration, not a prediction. This is the sorts of scenario that are coming up when we do our work, and we're sufficiently confident in something like this happening that the government should be aware of it and should be planning for it. I don't think they had any understanding, not just in Scotland but in the UK, that they were going to get a second wave. That was the likelihood. They should be planning the expectation they're going to get a second wave. I think there was a general belief that we would lock down, perhaps for a few weeks, and somehow the thing would be over. Extraordinarily naive view, but it clearly was circulating in the political circles around the UK. This was a temporary measure. And
indeed, contrary, as you said, to the advice you were providing about your experience of how these things tend to go in the briefings you were giving directly to the Scottish Government.
Yeah, more than how they tend to go, and based on the best analysis we could possibly do of the data on this particular infection in the UK, in Scotland. So no, not just based on expert guesswork. A lot more to it than that.
At a general level as well, another thing, you say this both in your book and also in the evidence you've helpfully provided to the module, that you had the impression that the Scottish Government's policy with regard to the management of the pandemic was that no death from coronavirus was acceptable. I'd be interested in knowing how you got the impression that that was the policy, if you like, or the approach, and also why it was you think that that policy caused significant problems.
So I thought it because the phrase appears in the Scottish Government's, I've got it here, Framework for Decision Making, published in
April document that I referred to earlier.
2020, and because, as I recall, the then First Minister said it several occasions. That's why I thought this was.
Thank you. And the second part was why, if it is the case that you consider it to be a problematic approach, it was a problematic approach.
It's empty rhetoric. It misleads everybody. Misleads the public. It gives an entirely false impression of what the future holds, how this pandemic's going to look. The idea implied by no COVID death is acceptable is a world where no one dies of COVID. That had gone. That had gone from December 2019. That was, as it turned out. But certainly I was clear it had gone by February 2020. And that's true because this year, 2024, current rates and similar to last year, hundreds of people in Scotland are going to die of COVID. Is that acceptable? Well, we seem to be accepting it. I mean, there's no great public health effort going on here to spare those hundreds of lives that are going to die of COVID. And as an aside, I think we're now not paying enough attention to COVID. Now it's a serious infection. It's killing people. May I go on?
Yes, please.
The second issue is, okay, how are you going to achieve this no deaths is acceptable? Well, the only possible way I could see of achieving it, other than literally some miracle cure, but let's leave that aside, is a zero COVID policy. And as I've explained to you before, the corollary of a zero COVID policy at that stage, this is April 2020 we're talking about, is indefinite lockdown. And it would still fail eventually. And this was being discussed at the time, and of course zero COVID did fail globally eventually. And so therefore it was never deliverable. And the other thing that upset me about this no death from COVID is acceptable, it devalues non-COVID deaths. And that isn't just a sort of philosophical complaint. The intense, very strong advice in Scotland to spare the NHS, particularly during the first wave, and not bother the NHS if you didn't absolutely need to, led to a huge spike. Well, first of all, it led, as you expect, to a fall off in the cliff, and the Eve project, of what I was a part, studied this on attendance at A&E or admissions to hospital. They just fell off a cliff. Most of the hospitals in Scotland had their quietest time in living memory during the first wave because no one else was going to hospital. And a lot of those people should have been in hospital. And in UK, thousands of them died at home. There was a massive spike in this. In Scotland, I think it was probably hundreds. I wouldn't want to put an exact figure on it. These people died. And so they died because the focus of the government was on preparing the NHS Scotland for COVID and concentrating on that. Because no COVID death is acceptable. Other kind of deaths apparently are. And they rose.
Thank you, Professor. To put that in the language of the Scottish Government framework, there was a significant focus on harm one, COVID-related harm and death, but too little concentration on harm two, non-COVID-related harm and death.
Absolutely, and that killed people.
And one, it would be reasonable to assume, would it not, you mentioned the non-COVID deaths, but of course there may be many people who have suffered significant morbidity as a result of not attending the hospital, whether that resulted in their death or not.
Well, indeed, but I mean, the non-fatal health harms went beyond that, and we might come to this. There was a study looking at the sort of health effects of both COVID, but also the implications of lockdown, so
Yes.
the indirect effects of,
Yes.
of the countermeasures. And that showed, by their best estimation, this was done by the Office for National Statistics and the Department of Health and Social Care across the UK, that actually those indirect harms over, not so much during 2020, but accumulating over time, would be considerably greater than the harms that would be caused by COVID. Sorry, having gone down this route, I must add an important rider.
Yes.
That is not a reason not to intervene against COVID. If you don't, then that side of the scale increases enormously. So, but it is an indication that we haven't got the balance right. So it's confirmation. It's another way of looking at the problem that you just highlighted as in terms of neglecting harm too. This is another piece of evidence said yes, we've neglected harm too, but not just in the short term, in the longer term as well.
Thank you. If that's an appropriate moment, lady.
Professor, as you know, we take regular breaks for the stenographer. I shall return at 11:30. Mr. Dawson.
Thank you, Lady. Professor, we were discussing before the break your impression of some of the key Scottish Government policies towards the management of the pandemic and their effect. I just wanted to ask you about one particular thing you say in your statement, which is related to the first lockdown, which is at paragraph 240, where you say, I do not know what Scottish Government's understanding of the COVID threat was at the time Scotland went into lockdown, but I don't believe that they truly accepted that the virus was here to stay. I am concerned that this short-term view of the crisis influenced both the politicians' willingness to impose lockdown and the public's willingness to accept it. The politicians were mistaken or misinformed, and the public were misled. You've given some evidence about your general impression already. Is there any element of that that you feel you would like to, anything you'd like to add based on that comment in light of what you've already told us in this regard?
Well, I can argue that what I say in that paragraph was correct. And the reason I say that is because by the end of the summer 2020, Scotland was flirting with a zero COVID strategy. Well, that tells me they didn't accept that the virus was here to stay.
And you think that was an important error in the way that they approached really the entire management of the pandemic, but certainly over 2020? Sorry, what's the error precisely? Well, the approach that they had, their approach to the COVID threat was that they did not accept that the virus was here to stay. So I have to say I didn't understand the Scottish Government strategy over the summer of 2020. The emphasis was on a very, very cautious relaxation from lockdown. And it seemed to be important to the politicians that it was more cautious than the one in England. So they were emphasising that. They didn't articulate, in any way that I understood, what they thought the public health benefit of this caution actually would be, and given what we said about a second wave. And then this segued into this idea that actually the fall in cases in Scotland would somehow continue and we could end up in zero COVID. So that, to me, was... I'm trying to think of a polite way of putting this. This was not consistent with the evidence that had been available since February 2020. So there's two elements, I think, to that period. One is whether it was the best way to approach things to release the lockdown in the gradual fashion that the Scottish Government did. And secondly, whether the zero COVID policy that you understood to have existed within Scottish Government showed a misconception about whether that could be achieved and sustained. So if we could try and take the two, one after the other. Just to put the first in context, you give an analogy at paragraph 16 to 17 of your report, which I think attempts to try to explain your views on this. I just want to try and unpack it a little, to do with a seesaw, whereby you talk about there being a difference between how far you go in relaxing restrictions and how quickly you get to that point. Could you please explain your views about that in the context of the Scottish Government's policy over that period which you've described?
Yes. As I say, I don't think the goals of the policy were clearly articulated. Not so much the immediate goals. They were laid out, and in May 2020 there was what was called a route map. So that was clear. That was absolutely clear. But my concern, and had been for so many months, was, but what is the long-term plan? Mm-hmm. Where do you see this going? Where are we going to end up? And as you well know, I was expecting to end up pretty much where we are now in 2024. But they didn't seem to be thinking that way. So the seesaw analogy is this. The emphasis on caution was somehow the idea that you could unlock, well, I think I'll come back to this, all all the way. You could come out of the pandemic by going very, very slowly. And the seesaw analogy is you're standing, just you, on the one end of a seesaw. There's a fulcrum in the middle of the seesaw, a tipping point, and the tipping point is actually the value r greater than 1. And the argument is that I think Scottish Government were making is if you go slowly enough along the seesaw, you can go past the fulcrum and keep going. No, you can't. It's going to tip down. And I don't think they understood that. And I didn't use the seesaw analogy at the time because I wasn't absolutely sure that's Scottish Government thinking. But it became very clear to me it was when we got into the second Scottish lockdown in January 2021. And repeatedly we heard that we're going to come out of this lockdown very, very slowly and cautiously because we made that mistake before. Well, no, that's not correct. So what you have to avoid, what the strategy should have been, was this: you can go as far as you can up the seesaw as quickly as you like. Makes no difference at all if you take 2 great steps and get there, as long as you don't go across it. If you want to go across it, then you have to do something else. You have to basically reduce the R number in other ways. So what I wanted to see was 2 things. So one was immediate, much quicker than the Scottish Government did it, relaxation of restrictions that were not clearly going to take us to the tipping point. And you want examples?
For example, please, yes.
Oh, well, I can give you 3.
Yes.
So, and there's very, very good evidence for all 3 now. The stay-at-home orders, the fact we were asked to stay in our homes, that was not contributing much. And well, this is getting complicated now. Okay. We can perhaps go back to a graph in the Scottish Government's framework, the COVID document, that shows this. But what that graph shows is essentially the R number coming down before we were told to stay at home. And when we were told to stay at home, it didn't actually come down any further. And there's actually, it's worse than that in Scotland. There are more ramifications.
So just to pause at that point, what you're telling me is that your scientific view was that the policy of gradually easing the lockdown didn't make a great deal of sense to you, didn't have scientific rationale.
No.
In particular, just take it stage by stage, in particular because your view was that you could get to the tipping point, i.e. release restrictions to a point where there was a degree of stability in the situation. And if you moved quickly towards that point rather than gradually, you would offset some of the ill effects of the countermeasures more quickly than a gradual release. Is that broadly correct?
Correct. I mean, the effect of the stay-at-home measures really, they weren't, I don't think, released until May or June. I mean, it was ages before.
And what I think you've identified is that there were a number of particular measures that you think could have been released more quickly.
2 more.
Yes, we'll get on to the others, but just to take it stage by stage, Professor. There are 3 particular types of restrictions that we all lived with that you think, based on that previous general rationale, should have been released more quickly, which would not have had a significant effect on the R number and would have significantly released some of the other harms related to those restrictions being in place.
Yes, not had no effect on the R number, but given our understanding at that stage, we could be very confident they wouldn't take us past the tipping point.
Yes. The tipping point being?
R becomes greater than 1.
Yes, thank you.
So one was stay-at-homes. The second one was...
So could we just deal with the first one quickly, just to be sure that we've understood this? Because, Professor, this is extremely interesting and important evidence, and a number of people will be listening to this who perhaps need to be taken through it a little bit more slowly, just so we absolutely understand everything you say. The first thing that you suggest could and should have been released more quickly, from a scientific perspective in your analysis, was that the stay-at-home order could and should have been released earlier. And you say that there is scientific evidence to say that that would not have tipped the R above 1.
Yes, I mean, I would take that further. The stay-at-home order was never necessary.
Right.
The job was already done by the measures. And I say there's actually evidence in the Scottish Government's own report
Yes.
that was the case.
So
Yeah.
that is based on evidence which shows that the R was starting to decline even before the lockdown.
Yes.
Did that result from the fact that people were voluntarily imposing on themselves a degree of social distancing such that the R was starting to be brought under control without the need for that severe imposition of a lockdown?
That's my inference, and I think a good inference. There may be other explanations, but that's the one I would.
Thank you.
highlight.
And you were going to tell us what the other two significant restrictions were that you think could and should have been released more quickly.
Outdoor activities. We had very good evidence going back from China that the novel coronavirus transmits very poorly outdoors, very poorly. So there was pretty much zero public health benefit to keeping us indoors. That wasn't required at all. We never needed to do that. There are caveats, like if people are outdoors and being intimate, well, yes, okay, that's something. But
Outdoors per se.
yes, there was never any need for that. And the evidence.
Could I just dwell on that before we get to the third one again?
Yes, sorry.
Just to understand, the restriction to stay indoors was something then that you say should have been released faster and earlier, and in fact shouldn't even have been there at all. Is that right? Would it be fair to say that had there not been restriction on going out of doors, that would have perhaps contributed to counterbalancing some of the other harms, such as the mental health harms or the physical harms that people might have started to suffer from being inside so much?
Absolutely, but I heard or saw very, very little consideration for those harms when we went into lockdown. To be fair, they were, I think, fairly quickly recognised by Scottish Government, but when we took that decision, I don't think that was at the forefront of people's minds. There was a lot of concern about how well people would tolerate lockdown, but that was an unknown. Mm-hmm. But I felt that discussion was more in the vein of, well, how long and severe a lockdown could we get away with that the public would tolerate, rather than actually looking at evidence of components of it and saying we didn't need them.
Okay.
Professor Woolhouse, sorry to interrupt. When you talk about outdoor activities, are you meaning things like going for a walk in the park, or are you talking also about outdoor activities like football matches?
Football matches were on the cusp.
Or because a lot of people are gathering, they're going there by public transport, they might go to a pub together, all those different variables.
Yes. That would, I mean, you'd need to do a fairly detailed public health appraisal of where you drew the line. But we, in the UK, arrested people for going on solo walks in the mountains. That's just utterly absurd. That devalues the whole idea of social distancing when anyone can see. This is nonsense. But it was done. May I?
Absolutely.
Another good example, there was an absolute outcry in the summer of 2020 that people were going to beaches. There was never, ever an outbreak of COVID-19 anywhere in the world linked to a beach. It was fine. People could go to the beach. But nonetheless, we were very resistant to that.
Thank you, Professor. The third element that you were going to tell us about that should have been released more quickly was?
So this is not in the category of things we knew well enough not to include them in the first lot.
Yes.
The first two, we never needed.
Should never have been there.
Yep. 30 schools. And it quickly became apparent through April and May 2020 that schools were contributing a little to the spread of the virus, but so little that there was essentially no danger that reopening schools would take us past the tipping point.
Just to pause there, I think because you said it very quickly, I think you said there the closure of schools. Is that correct?
Yeah.
It just wasn't quite picked up by the stenographer.
I beg your pardon. So closing schools, I accept essentially as a precautionary element of the first lockdown, because let's face it, we were practically panicking at that stage. It was necessary or justifiable. But we should have realised much, much more quickly, based on the evidence emerging from around the world, that this was not an essential element of our lockdown. So in my view, and when we come to this, I argued it repeatedly and frequently over that whole summer, schools in Scotland could have reopened in May 2020, just as they did in Denmark.
And what about school closures as part of the second lockdown, which also occurred?
One of the positive elements of the way the pandemic was managed in Scotland was that we were the first nation to reopen schools when, particularly in England, there was a lot of resistance to it. I think we did that partly, at least partly, on the basis of the advice that came out of the Scottish COVID Advisory Group, which I was a part. I think that advice was too slow to pivot to it's safe to reopen schools, but it did get there, and we opened them in August. And I thought that was a real success story, an evidence-based decision by Scotland to do something that was safe and was so important to do. And I was feeling that actually being an advisor was quite a good thing, that actually we could get things done that really helped. And then when we had the January lockdown, schools were closed again, arguably because this was now the Alpha variant and there was more uncertainty, as a precautionary principle, yes, but it very quickly became apparent in that second wave that schools did not need to remain closed and we could still control the virus, and yet they weren't fully reopened here until May 2021. This was unnecessary. Forgive me, this is one of the aspects of the pandemic management that I really feel very strongly what we did to the children. And it would be bad enough if there was a detectable and measurable public health benefit to this, but there wasn't. It wasn't necessary, and we did it anyway.
Could I just clarify one? It could be applied in connection with the schools, the evidence you've given, but it could be applied more generally. When you differentiated between the first two categories, which you say should never have been in place, and schools which you accepted would have needed to have been in place, but for a much shorter period than the restrictions actually applied, that is based on the position in which Scotland found itself when the lockdown was announced on the 23rd of March. Is that correct?
It's based on the evidence that was available when that decision was taken.
But is it your position, if one takes it further back in our narrative that we've been discussing, to the discussions that we had about the warnings you were trying to convey to Scottish Government, if we were trying to assume a hypothesis which worked on the basis of those being heeded in the way that you had hoped they would be, would it have been possible to have avoided that happening in that scenario, and indeed avoided a lockdown at all?
Yes. May I hark back to Module 2?
Yes, if it puts it in the context which is required for Scotland,
yes,
that would be very welcome, thank you.
So, Module 2, Mr. O'Connor was interrogating me quite hard about the difference between my maxim for managing this pandemic of go early so you don't have to go hard. And he pointed out Patrick Valence's counter to this, that you should go harder than you want, earlier than you want, wider than you want. And Patrick Valence, when he gave evidence after me to Module 2, addressed this, and he said, well, yes, but how hard? You know, Professor Wallace says you don't have to go so hard, but you still have to do something, so is that not pretty much the same thing? That was his argument. Well, my counter to that is no, it's not, for the reasons we just gave. So if we had gone earlier and done all the things apart from the three I mentioned and seen them working, we would never have had to close schools. We would have seen it wasn't necessary. So I don't accept Patrick Valence's counter to that at all. I mean, you know, his strategy led to us closing schools. Mine would have let them stay open for the whole pandemic.
Thank you. Can I address another general concept which flows through all the evidence, I think, that you've given, which we've touched upon? And again, to try to use it's developing a theme we've talked about earlier in the context of zero COVID policy, to use the language of the framework. The area that I'd like to explore with you is the extent to which what you perceived and understood the greater focus on harm 1 to be resulted in harms 2 to 4 being much worse than they really should have been. Broadly speaking, can you explain, Professor, your view as to whether the Scottish Government policies took adequate account of we've already covered non-COVID health harms, but wider societal and economic harms?
Very simply, in my view, no, they did not. But then we get into this very difficult territory, which the politicians exploited a lot. If you don't intervene as hard, more people will die. And since they were working on this maxim that no COVID death is acceptable, clearly that's not something they're going to do. So in order to counterbalance these relaxations, you have to do other things. And not only me, but Scottish Advisory Group was very clear on the other things you could be doing to keep the R number low, but still allow you to relax restrictions and therefore avoid a lot of the harms that were being caused, the harms 2, 3 and 4, as you say.
We have evidence available to us from Scottish Government that during the course of 2020, for differing periods at different times, a number of advisory bodies, separate from the body to which you're affiliated, the Scottish COVID Advisory Group, were set up in order to try to provide advice and evidence information to the Scottish Government about a wide variety of things, including things that might broadly be described as falling in harms 2 to 4. There are those the remits of those groups are all set out, but if your position is that ultimately, in terms of effect, the Scottish Government's policies failed adequately to recognise those harms over the course of the pandemic, must it be the case that those systems were ineffective in that the ultimate impact from harms 2 to 4, so I understand your evidence, was larger than it should have been?
I think to a large extent the 4 harms policy, which when the 4 harms were first mentioned, I was greatly encouraged.
Yes.
I was thinking it was rhetoric. It was rhetoric. The emphasis was overwhelmingly on harm 1, even when, particularly during summer 2020, the public health benefits of continuing to suppress the virus were extremely small.
Thank you. I'd just like to focus in, we've talked about it already, the period when the cases started to rise again, which eventuated in the second lockdown. Is it your view, in relation to any of the harms, frankly, the harm that you're focused on, harm 1, or any of the other harms, that you think the Scottish Government learned lessons about the experience of the period up till, say, September 2020, as regards how best to manage the pandemic, or that they repeated the same mistakes?
I think now the second lockdown in Scotland, of course, was January.
Yes.
And cases rose in the autumn, as you said, in the second wave, but also came down without a full lockdown in Scotland.
Yes.
So that was a big difference from England. And
just to be clear, there was not a full lockdown, what's known as in the other nations a circuit breaker lockdown, but there were significant restrictions at times imposed over the period.
And I think, sorry, I've completely diverged from your original question. Can I address this point and then come back?
Absolutely. Thank you very much.
Right. I think one of the reasons that we didn't in Scotland go into that November lockdown was it would have been counter to the advice coming out of the group I was on, COVID-19 Advisory Group. We were not in favour of a lockdown at that stage. And as I say, we had proposed many other interventions that would reduce. But even though most of those weren't taken up. In fact, we didn't need the lockdown in Scotland.
Just to be clear, Professor, what was it? You mentioned November, which is obviously when the English lockdown took place. There were other lockdowns. Over that whole period, really from September onwards, there was consideration of a circuit breaker. Did it remain the Scottish Government COVID Advisory Group's position that they didn't recommend a circuit breaker over that whole period?
Correct.
Thank you.
Yes. And again, harking back to Module 2, I'm afraid, I know the inquiry was given evidence from a number of very distinguished scientists and advisors about the inevitability that this second lockdown in England was absolutely essential for controlling the virus. Well, we didn't have one in Scotland, and we controlled the virus. So I have to say, I think that simple fact rather discredits all the evidence the inquiry's heard on this point before. Scotland proved what I have been claiming, that second lockdown in England was unnecessary. It wasn't necessary here, it wasn't necessary in England either.
As regards the second lockdown in Scotland?
Right, the second lockdown in Scotland was January. And yes, you asked me if Scottish Government had learnt some lessons. They learnt some. So the restrictions that were imposed on us during that lockdown were definitely less severe. The very strict stay-at-home orders, the amount of time you could spend outside, those were relaxed in that second lockdown, so that's fine. And again, proof of principle, even with a more infectious variant of the virus, we didn't need them. We still controlled it, so that proves what I was saying about the first one. We didn't need those elements. But sadly, they did close schools and kept them closed. So they didn't...
Which we've touched.
Yes, but I don't understand how we went from the position of actually being quite evidence-based about decisions on school closures to suddenly forgetting all that in early part of 2021. It baffles me.
And if I might ask again a broad question about the approach to the period thereafter, because the inquiry has heard significant evidence about, as a result of Delta and then subsequently Omicron towards the end of the year, Scotland having very significant cases, even in comparison. Obviously the infectiousness of Omicron was higher, but the numbers compared to the rest of the UK being highest in Scotland. Scotland suffering a significant mortality almost to the same level as the first two waves, in what one might describe as the third wave, and the NHS being driven to the point of procedures having to be cancelled, the military having to be called in to provide assistance. One of the things that we noticed was that from June 2021, the group that you sat on with a considerable amount of expertise sat much less frequently in that period, other than a cluster of meetings around about December 2021. It sat really monthly, we think, from June 2021, at a time when the cases started to rise again as a result of Delta. Do you feel that at that stage, although you've pointed earlier to there being a focus on harm one, that there perhaps was an insufficient focus by that period on
with infection through schools again, but
given the
word not mine. I hadn't reactivated during the...
You were a member of the... did you have any...
I mean, I did not do that, and
Did you... messaging systems?
address
Did you... messaging systems?
address because we actually contacted it through that way. But I...
Just one.
It's because we actually contacted it through that way. But I...
Just one question. I just want to. You said that the. Question. I just want to. You said that the necessary because of the seesaw.
So the Scottish Government strategy...
Necessary because of the seesaw.
So the Scottish Government strategy, test and protect, really keep on... Scottish Government strategy, test and protect, really keep on top. Scottish Advisory Group with... and top. Scottish Advisory Group with the need to self-isolate, but even... the need to self-isolate, but even system in all. We needed mass testing. Summer and into the autumn, and, was do more to protect. Save lives. Plain fact of...
It's not as straightforward as just like, I mean, and it's not as straightforward as just like, I mean, and
No, got to put the effort in. Government here on preparing to happen, is it? No, it didn't.
Planning and...
As Cullen was being taught in Scotland and elsewhere, tested our way out of it.
Believe that there's just one method to just
Much indeed, first of all...
even richer. Even richer.
Declare and defer the truth.
Lady.
Statements, one for 7. That's hopefully come up on page 79.
I mean, I have done a little.
And 02738 and of St Andrew and scientist, but
It's a term
and as a social psychologist, you're
that's been on the social influence expertise with
the pandemic of the knowledge gained in respect of
social influence, expertise with
the pandemic, of the knowledge gained in respect of how it spreads?
Well, the way I saw the advisory committees working was that it is for the medical scientists to tell us what sort of behaviours are likely to spread the virus. I'm not an epidemiologist or a virologist, as will become abundantly clear, so I can't tell you what behaviours are necessary. But once they can say to me, look, these are the types of behaviours that increase transmission, I can begin to think about, well, how might we be able to change those behaviours so as to reduce transmission? So it's very much, to use a medical term, a biological term, a symbiotic relationship where each depends upon the other. We very much depended upon them. I think they also depended upon us.
So to put it in a sort of with an example, the epidemiologist will come to you and say, the evidence suggests that the virus spreads as a result of close contact within 15 minutes, within a metre of one another for 15 minutes or more. And you, as a behavioural scientist, to use the phrase that you don't like so much, say, well, how do we think about how we influence behaviour? What do we do to make people not stay within a metre of each other for 15 minutes in unventilated areas?
To a large extent, although I would make a couple of points in relationship to that. The first is, I think the whole dilemma of the pandemic, and the reason why it's so difficult, is that the core thing we needed to do was to keep people physically apart at a time when we know that being socially together is critical to human well-being. And early on in the pandemic, in 2020, we wrote a book called Together Apart, I think it's in the evidence, which tried to summarise the nature of that dilemma. We're trying to deal with something that's really, really difficult. And the second thing is, and again, this is going to be critical to the points I shall, I think, be making subsequently, depending on your questions. It wasn't us making people do anything. It wasn't us telling people to do anything. It was how can we engage with the public and jointly do something. And I think as long as we see things in a top-down manner, actually we get things grievously wrong.
Because, and again, sort of applying what you've just said, in times of humans are inherently social creatures, as it were. Yeah. And no doubt, in times of strain and stress, require more social interaction, or would be expected to have more social interaction and community support at exactly the time when that social interaction was causing illness, the spread of the virus, and ultimately death. And
well, you see, I think that wasn't necessarily true, but I think we made a huge mistake early on in the pandemic when we talked about social distancing, and that phrase became virtually universal. We talked, we've got to socially distance. Actually, we didn't have to socially distance. What we had to do was physically distance, because physical proximity led to the transmission of the virus that could kill you. We didn't want to socially distance people. We wanted to keep them together. And the fact we conflated the two, we talked about everything as social distancing, meant that we didn't put enough effort into asking the question, how can we keep people socially together? How can we keep people connected, especially more marginalised social groups during the pandemic? So it wasn't a natural contradiction. I think we turned it into a contradiction by failing to recognise that distinction between physical and social distancing.
When did you start to see that contradiction really coming to the fore in terms of the use of social?
Well, as soon as the phrase was used. I mean, as I say, we wrote a book. Academics are rather slow creatures, as you might have discovered. We managed to write a book in, I think, 2 months because we felt this is such a critical issue, In fact, there is a whole psychological literature which I've been involved in, which shows the importance of social connection, not only for physical, but for mental health. Feeling part of a community, I could go through a long list, and I won't, of the various ways in which it benefits you. So I was acutely aware of this tension right from the start. And a lot of my work has been around how mass gatherings, collective behaviour, which is often seen in negative terms, is actually rather good for us in fostering a sense of community and improving our physical and mental health.
We'll come on during the course of your evidence to sort of specific examples, but we've started down this path a little, so let's continue. So you recognise, or you recognised early on, as soon as the phrase social distancing was an issue, it created its own issue. Was this advice that you were feeding into SCAG and more broadly? Beyond, although I appreciate having written a book, you might suggest it's out there, as it were.
Well, I think the core psychological issue for me was this. I've already made the point that for me, one of the major implications of the pandemic as a whole is it told us behaviour matters. It doesn't just matter at an individual level. It's not just a matter of interpersonal relations. It matters at a systemic and societal and policy level. And one of the first times that people thought of psychology and policy together. But that then raises the question, what sort of psychology do you use? Now, my work, in general and on disasters as well, shows the importance of bringing people together as a community with a sense of shared identity, a sense of we-ness. And often, when you look at the popular representation of crises, there is this notion that we panic. In other words, in a crisis, we act individually, we all rush to the exits, we trample others, and we turn a crisis into a disaster. Actually, the evidence that I've been involved in, my colleague, Professor John Drury, who's also on SPI-B, has been involved in, shows that what tends to happen in a disaster is that you have a common fate, a common experience, and people come together as a community. It's a frail sense, it can be undermined by government action, but that sense of shared community is absolutely critical in the pandemic response in a number of ways. First of all, it means people care for others. The early polling, for instance, showed that the major factor in adherence to measures was wanting to come out of this as a community. And our own research shows the key factor in adherence is not your individual risk, it's the collective risk, it's the risk to the community. So creating a sense of community increases adherence. It increases solidarity in practical terms. We saw that 12 to 14 million people became involved in mutual aid groups, probably more if you include, we've heard a lot about WhatsApp, but informal, street-level WhatsApp groups where people look out for neighbours. And also that sense of community is good for our physical and mental health. So in a sense, if I had one message, it was, don't fear the public, don't fear their frailty, don't see them as a problem. Rather understand that if you bring the public together as a community, and what's more, that they see government as being with and for that community, then the public become an absolutely key resource. They're not the problem, they're the most precious resource you have. And all my interventions, in a sense, was about how do you achieve that? How do you scaffold that? How do you support that? How do you create that sense of community? So this was one aspect of that absolutely key critical message that I was trying to get over in all the various places that I spoke.
Could you speak a little more slowly?
Oh, I'm sorry. That's slow for me.
I was just...
But I will
I know
try
the
to do
feeling
better.
I speak too quickly as well.
We have a stenographer who is typing away frantically.
I'm sorry, stenographer.
Could we, in light of what you're just saying about public adherence, could we look at paragraph 63 of your witness statement, please? I think this is what you were taking us through, but I just want to sort of orientate ourselves. And you talk about the sort of how the factors of public adherence to guidance, legislation. We'll come on to that shortly as well. But you say that the factors that have been seen before COVID came along were actively applied. It remained the same in terms of the actual in the COVID response, despite the fact that of course COVID was somewhat unprecedented and rather different, no doubt, to the studies that had been in terms of disasters otherwise, in terms of longevity and acute issues. So you say that the first issue, or the first factor, is risk perception. So by that, do you mean explaining to people and making everyone aware that this is a big deal? People can die, people can become very sick, or is it a broader sense of risk perception in that regard?
So I'm glad you brought up risk perception, because I think it's an absolutely key issue, and I think there's been much misunderstanding of what was said around risk perception. One of the criticisms made of SPI-B and of behavioural science in general is that we wanted to use fear to frighten people into adherence. But there is a huge difference between making people realistically aware of threat so that they can do something about it, and fear, which makes you feel, well, we're doomed, there's nothing we can do.
The equivalent of
the
shouting...
point is... Sorry.
The equivalent of shouting fire in a room but not having fire exits that people can
The analogy I
look
often
to.
use is, I don't say to my child, the world is a terrible, dangerous place. If you go out, you'll be killed. I say to them, look, there are some real risks out there, like crossing busy roads. So be careful. This is what you do. You obey the Green Cross Code, and you will be fine. So if you give people realistic risk information combined with information about how to mitigate it, actually it doesn't increase fear. If anything, it decreases fear because it empowers people. And the core concept for me here is empowerment. You disempower people either by not telling them what's going on. To hide risks from people doesn't empower people, it disempowers people. And you also disempower people just by talking about threat without mitigations. If you want to empower, you do the two together. And that's what we were saying time and time and time again. You need to make people realistically aware of the threats, because if there's no threat, why should you do anything, right? If the virus either isn't there or can't harm us, why would you do anything, from getting vaccinated to keeping distance or whatever? And there is ample research, both from previous pandemics, the H1N1 pandemic, a lot of research in Hong Kong, but equally within this pandemic, that making people realistically aware is important. Now, if I could just finish by going back to my previous point. If you have a sense of the public as psychologically frail, unable to deal with information, you say to yourself, oh, I can't tell them anything, because they'll panic, right? But if you actually have respect for people and are open with people, and not only give them information, but the wherewithal to deal with that information, actually, you can be really effective. And that's why that general attitude that the public are a problem, the public will panic, gets in the way of doing the things you need to do in order to be effective.
And you say in your statement, I think, as hopefully not paraphrasing too much on this, that the third element, or the third factor, is that social identification. So there's a sense of all in it together, and that is part and parcel, is it not, of we can do something, we can move forward if we're all in it together and we're all pulling for the same team, as it were.
I mean,
is that what you mean by that?
One of the problems of the pandemic generally is people talked in terms of binaries. It's either this or it's that. It's this factor or it's factor. Of course, when you deal with human behaviour, there are always multiple factors. Now, we tend to like lists of three, so I think I've given you 3 factors there. I'm not saying these are the only factors. However, there was a hugely influential paper, probably one of the most influential papers in the whole pandemic in terms of behavioural science, which was published in Nature on harnessing behavioural science. And there we made the point that when you look at the research on disasters, this sense of shared social identity, of we-ness, is absolutely critical. And Nature has just published an analysis which looks at all the literature that came out of the pandemic, which confirms the importance of doing this. This only came out a month or so ago, so I'm not sure if it's in the bundle. But the point is this, okay? If I am young and relatively healthy, and sadly I'm not that young, but if I'm young and I'll have my son in mind, he might say to himself, if he was thinking individually, look, I might as well go out during COVID because the risk to me is relatively minor and the cost of staying in at 18 or 19 with your elderly parents is huge. Okay? So you do the cost-benefit analysis and you think, well, I might as well go out. If you think in collective terms, right, now not the risks and benefits to myself as an individual, but to the community, I say to myself, if I go out, I might spread the disease and I might kill somebody who's elderly or vulnerable or whatever. And so the risk calculation flips over completely. So thinking in terms of we, having a sense of this matters to us becomes absolutely critical. And we've confirmed that with a paper published at the beginning of this year, which is that sense of collective identity. And I care about the community. And one of the things that worried me a lot was that as we went through the pandemic, we started off and nearly everybody was saying that. Certainly as we shifted to notions of personal responsibility, we began to help develop a notion of I'm all right, Jack. And I think that undermined the response. I think it undermined it practically. I think also morally and ethically we were produced a society which is less concerned about its more vulnerable members. And I think that is equally corrosive.
Might an example of that be, for instance, the vaccine passport that you speak of in your statement, in terms of all of a sudden you've got this, you've been vaccinated, so you've got you've got your own thing to prove you're fine, and there is a risk, is there not, in those circumstances of forgetting the collective, as it were?
Okay, so I think vaccine hesitancy, you've gone straight to the heart of it. It's a brilliant example of these issues and allows me, I think, to illustrate them very, very clearly.
Before you go any further, I suspect our stenographer is still going to be struggling because if you could slow your answers slightly, I'm sorry.
But do help me by telling me to go more slowly.
Thank you.
There are two broad ways of which you can deal with vaccine hesitancy. One is to say people don't take the vaccine because they are too stupid or too immoral to care. They're selfish. So you can say there's something wrong with those individuals. Now, the problem with that is that when you look at the figures, the statistics on vaccine hesitancy, they are much larger amongst certain groups, more deprived groups, ethnic minorities, in particular black British people, much less likely to get vaccinated. Now, if you go down that individualistic route, you then come up with conclusions like black people are either less intelligent or less moral than others, and hopefully none of us want to go down that route. An alternative approach is to say it's not about the information itself. It's about our social relationship to the source of that information. Do we trust those who are giving us this information? And there is good reason to understand why certain groups have less trust in government, because historically they have been treated differentially. There was a report, for instance, that came out at almost the same time as those statistics came out from the House of Commons, the House of Lords, which showed that 60% of black people felt that the NHS did not take their priorities as its priorities. So the key issue becomes not the intellectual or moral abilities of the individual, it becomes an issue of building trust. And how do you build trust? Well, one of the ways you build trust is not to say there's something wrong with you if you have questions. You should have questions if somebody wants to inject something in your body. It's perfectly reasonable. So you shouldn't treat people in negative terms. You should engage with them. You should have dialogue with them. You should work through their communities. And in fact, early on, we wrote a paper on community engagement showing historically it had been massively successful around the world, especially with minority communities. So vaccine hesitancy shows us some of the pitfalls of that individualist, there's something wrong with the individual, rather than that issue which says what's primary are the issues of social relationships. How do we get people to see government as being on their side? Vaccines introduced for them rather than something done to them. How can we make people see government part of us rather than standing outside and waving fingers at or punishing or bearing down upon us?
We'll move on in a moment to enforcement issues and around legislation, but just coming back to the vaccine passport in particular, because in your statement, I think you raise concerns about paragraph 105 and 106, that the concept of vaccine passports. And I don't want to get into the detail about how it all worked in practice.
Yep.
I'm sure the Enquiry will be dealing with that in due course. But what I'm interested in is the messaging surrounding that and how that fed into Scottish government decision making. Because you say in your statement, don't you, that you were opposed to certification. Why was that?
Okay, so again, we published a paper which showed that, especially amongst groups who do not trust government, then vaccine certification increased or gave traction to the anti-vaxxer narrative of they're trying to control us, they're trying to do something to us, and thereby decreased their willingness to get vaccinated. It did have some positive effects. So, for instance, for people who didn't have that distrust, who hadn't got round to it, then if there were going to be consequences, then they might as well do it. What that means is you would more rapidly, in a sense, vaccinate all those willing to be vaccinated. The problem is you would do that at the expense of widening the pool of those who were more resistant to getting vaccinated. So my feeling very strongly was we should focus on engagement. We should focus on working with those communities, on listening to people. There are some very nice examples of that engagement, in fact, from Israel, where in Tel Aviv, they took trucks to the downtown area of Tel Aviv, Dizengoff, and people could come in and they could have a snack, they could have a drink, not alcoholic, and they could get vaccinated. At the same time, they did that in religious communities, but there they didn't give them drinks and snacks. They gave them cholent, which is a stew that religious community. And so, once you understand the different communities, what matters to them, how you engage to them, how you go to them rather than wait for them to go to you, you have a hugely effective intervention. And that, to me, was the way to go. Always respect people, listen to them, engage with them. And so it's true of vaccine hesitancy, it's true more generally. Respect people.
You say at paragraph 105 that one of your concerns about vaccine rollout and vaccine passports per se, again, was leading to a sense of invulnerability and loss of caution. Is that, to bring us full circle to where we started this discussion, is that the risk of something like a vaccine passport gives rise to the breakdown in the social identity, as it were?
So there's been a lot of discussion about if you make people safer in one dimension, will they become less safe in another dimension? If you give people a Volvo, which is supposed to be, I'm told, I'm not advertising here, but it's supposed to be the safest of cars, or at least was, do people drive more riskily? So risk compensation is the concept. Actually, the literature nowadays shows that it's not clear there is risk compensation. What is critical is to give people clear messaging about what things do and what people don't do. Now, there is a danger again that if you don't respect people, if you think people are intellectually impoverished, you try and make things terribly simple. You either say a vaccine is perfect, or others say it's completely useless. Okay. Actually, I think the important message is to say, look, a vaccine is far, far, far better than not a vaccine. It does these various things for you, but it still doesn't do everything for you. So you still need to be careful. You still need to keep your distance. You still need to, self-isolate if you're infected or whatever it might be. And the danger is, again, it's this general attitude. If you don't respect people, If you have a sense of the intellectual frailty of the public, it leads you to simplify and not do the messaging that you need to do in order to avoid risk compensation.
And how receptive was Scottish Government to your particular concerns in respect of vaccine passports and the risk of anti-vax, all that sort of thing?
In general terms, and I think I've given a number of examples of this, nobody's perfect. We all learn and we all make mistakes. But what is undeniable, I think, is that the Scottish Government did far more, both in terms of this general notion of treating the public with respect and as a partner, than the UK government did. And in my statement, for instance, I have compared and contrasted certain statements at the same time by the Prime Minister and the First Minister, showing how, on the one hand, the Prime Minister tends to tell people off and to threaten to punish them. The First Minister tends to recognise the difficulty people have, the efforts that they are putting into compliance, and encourages them to continue with those efforts for the sake of the community. So by and large, comparatively at least, I would say that the Scottish Government did better than the UK government.
You talk in your statement at paragraph 12 in the concept of Scottishness. I'll just allow a moment for this to be brought up. I'm jumping around rather unhelpfully. Thank you. So it's the second half. In the Scottish context, it's possible to draw on the idea we are Scotland because Scottishness is more likely to be, I've lost my, understood in civic terms as including all those living in Scotland and committed to Scotland, whatever their background, while we are England is more problematic, more likely to be understood in ethnic terms, hence excluding those from ethnic minorities. Consequently, the advice as to how to build cohesion and solidarity was different, and indeed, I think there's an extra there. In Scotland, I had the pleasure of working with the creatives in crafting public health adverts rooted in norms and values of Scottishness. I'd just like to explore that with you briefly before the lunch break. What do you mean by Scottishness in civic terms, and how that impacted the advice you were giving to Scottish Government and their creatives in the messaging?
That was a very dangerous question to ask an academic. I mean, I've worked on national identity. A number of years back, we wrote a book on national identity and Scottish identity called Self and Nation, available at all good booksellers. And I could talk for a long, long time, but I won't, so, I promise you. And I'll try and say this slowly. I think there are a couple of key issues here that are really important. Okay? One is a broad conceptual point that when I think about human psychology, I think we are all equally human and the basic psychological processes we have are the same everywhere. But the way those play out is fundamentally different in different contexts, different cultural contexts. Okay? So I am interested both in the general process. I might say that if you create an inclusive social identity, people will support each other within that broad community. But how you achieve an inclusive social identity depends upon the cultural resources and the cultural history that you may or may not have. The second general point, and I have been listening to you on the TV channel, and so I've heard various times people asking, why on earth did we need a Scottish advisory group? I mean, surely, it's the same pandemic, so why did we have to have a different advisory group? And the point is, again, that the context of Scotland is different at a number of levels. People have focused on geography. We are more dispersed. They have focused on comorbidities. We have more comorbidities in various areas, but it's also psychologically different. So when you look at the notion of nationhood, this is too simplistic, but people broadly draw a distinction between ethnic and civic nationhood. Ethnic definition is where I come from, okay? By that definition, I personally am not Scottish because I was born in England. My parents came from Russia and Germany and Poland. Okay. But if I look to my future and my commitments, right, I can call myself Scottish because I live in Scotland, I'm committed to Scotland, my son was born in Scotland. So civic is very much about your future and your choice over your future. Ethnic is much more to do with where you come from. Now, in England, Englishness historically has been seen as more ethnic. You know, so, for instance, far-right groups use the flag of St. George to denote an England which is defined in terms of whiteness. And the empirical evidence shows that ethnic minorities would find it very difficult. Say, for instance, I am Pakistani English. They might say I'm Pakistani Mancunian because they can relate it to a locality, but not to a nationhood. That's not true in Scotland, because over the last 20 or 30 years, and these are balances, I'm not saying it's entirely one way or another, but the balance has moved towards a notion of Scottishness, which is to do with being here and committed to the nation. It's beautifully expressed by Willie McIlvanney when he used the term the mongrel nation of Scotland. What makes Scotland is we're not pure breeds. We are a mixture of all sorts of things. That's what makes us Scottish. So when you say we are Scotland, you include ethnic minorities. You include people who have come from elsewhere. When you say we are England, you are more likely to exclude and create a sense of division. So it's a beautiful example of the social differences and the way in which you can use Scottishness to create a sense of an inclusive social identity, which includes everybody and brings them together, as opposed to an ethnic identity which divides people and which could exclude people, and at worst can even lead to hostility against minorities.
You spoke about Spy. Well, you're a member of SPI-B in the UK setup, as it were, and then you joined SCAG, as we call it, in March 2020, April 2020, just after the lockdown. You joined that. You joined SCAG, I think, as a result of you reached out and said, hang on a minute, you're not, I think I can help and I can bring some expertise. What was your understanding about the Scottish Government and CMOs, etc., using the original title of SCAG? What was your understanding about the Scottish Government's recognition of behavioural science and behavioural management, as it were, in that sort of regard? Is that why you said, come on, I can help. Yeah. I can bring something to bear here?
I mean, the simple answer to that is I have very little understanding of the workings of government. I've always been an academic trying to understand various processes. I have worked with various groups. My work on crowd behaviour has influenced public order policing, for instance. And I've been on one or two advisory groups about behaviour in emergencies. But by and large, my understanding of the workings of government come more from Yes Minister and Yes Prime Minister than any privileged knowledge. I reached out to Rebecca Widderfield because she was then the General Secretary of the Royal Society of Edinburgh, in which I was heavily involved. But I knew Rebecca from the past, from some of her directorates, talking about, if you like, the behavioural dimensions of environmentalism, resilience, and so on. I passionately believe, and the important message I want to get over is that behaviour matters at that systemic level, and we need to understand that and learn that, both so we can contribute, but also so that we can be involved. And so I knew nothing about the Scottish Government, but I thought if anybody might help in making the case for behavioural science being involved in the debate, Rebecca would, because she had been doing that previously when she'd worked for the Scottish Government.
And when you joined SCAG, you were the only, again, to use the wrong phrase, as it were, behavioural scientist on
it was lonely. It was lonely.
The start. How did you feel your voice was heard in that room, as it were?
There's always a danger if you think you're going to sound as if you're gushing, okay? But one of the things I learned, and I learned many things from my involvement, was how to chair a committee. I think Andrew Morris was remarkable. He included everybody. He wanted to make sure that everybody had spoken. He defined a good meeting. He would often say, it's been a good meeting, everybody had spoken. He wanted to make sure that everything was covered. And so I got a really strong sense, in part because of the others, because I think people recognise that symbiotic relationship I've spoken of, and it was facilitated both by Andrew and by the civil servants we worked with. I was very lucky to meet and work with such people.
Did you feel like the issue of messaging and the issue of recognising or seeking to influence human interactions and human movements in the context of the pandemic was something that was adequately recognised from the outset?
Okay, so people often, when they think of behavioural science, they talk about communication. Okay, and I think communication is an aspect of it, but I think the core issue was understanding the centrality of positive social relationships, and in fact, and this is utterly key, a social relationship of trust, both within the population and between the population and government. And Andrew used a phrase which I really liked, where he talked about that social contract of trust. And he was aware that that was utterly central to everything we did. I used to say at the beginning, as many people did, that behavioural science will be important until vaccines come along. But I was wrong. The reason why I was wrong is that vaccines achieve absolutely nothing as long as they're in the bottle. It's getting vaccinated that makes a difference. And so as soon as you have a vaccine, you have a new behavioural set of questions, which we've addressed in part. How do you get people to get vaccinated? So it's not as if, the pharmaceutical is primary. It will be the cavalry charging over the hill, after which everything else becomes irrelevant. It's that at every single stage, the behavioural and the medical need to go together, and absolutely key to addressing that is creating that social contract of trust. And in some ways, as I say, that phrase came from Andrew. I think he understood it really well. Now, as to whether others understood it, I don't know, because my experience was in the advisory group. I don't walk the corridors of power. I don't know what ministers say to each other in private, but I do know that within that group, I was deeply impressed by the extent to which it was seen as a community of equals from different disciplines.
Thank you. My lady, would that be a convenient
Yes,
moment?
certainly. I shall return at 1:45.
Grateful. Thank you, my lady.
gather you may have had a problem with the live feed this morning.
Used to be, my lady.
It's resolved by the sounds of it. Anyway, apologies to anybody who was watching and was affected by the problem.
Thank you, my lady. Professor, before the lunch break, we were talking about using messaging to influence behaviour. In a world of social media disinformation and people simply not engaging with mainstream media, with the news, how do you get the message out to those people who are perhaps less likely to comply in the first place with that guidance?
And that's a really important question, I think. And again, I would want to go back to this core issue of social relationships and trust. You see, when people deal with misinformation, the obvious starting point is to ask about the nature of the information. But imagine a situation where, and that actually it's a situation that happened to all of us, okay? That you are sitting there, you're being asked to take a vaccine, to inject a vaccine into your body. And some people are saying to you, this is really important. This will keep you safe. This will keep your community safe. It's a personal and a social responsibility to do it. And others are saying to you, don't trust them. They are not concerned with your well-being. They are trying to control you. This vaccine hasn't been properly tested. It hasn't been properly developed. It's dangerous, right? Now, we're not vaccinologists. So in the end, you've got to ask, who do I trust? Who do I think is on my side? Who is giving me this information to help me? Who is giving me this information in order to control me? So when it comes to that issue of information, and it's not just about disinformation, the question is, why do we believe any information we're given? It's not the information itself, it's our social relationship to the source of that information that is often absolutely critical, and that's why trust is absolutely at the core of how you respond.
But how does that work in practice in terms of Scottish government? And when the First Minister, for instance, stands up to describe what's happening, how do you use that to get? I
think it has to be in the context of that wider policy of engagement. So if there you are, you're going for vaccination, and somebody says to you, and you ask a question, what effect will this have on me if I'm pregnant? What is the impact on sickle cell disease? These were questions to which non-experts wouldn't know the answer. Do you, on the one hand, treat that person as dishonourable, as a fool, label them as vaccine hesitant, or do you say to them, really good questions, right? Really good questions, we'll talk to you, we'll listen to you, we'll engage with you. So whatever that Scottish minister says, it will work better in a context where you are building trust, you are showing respect, you're engaging with people, and you're taking their concerns seriously, rather than just dismissing them as fools who are victims of disinformation.
But to what extent does the existence of those issues in terms of people who don't want to engage affect the decision-making, the principles behind the decisions that are being made in government to say, we need to do this, we need to do that, and give advice and building up that trust relationship? To what extent is, in your view, were Scottish government aware of the impact of that sort of issue on the efficacy of their decisions?
Well, as I've said to you many times, I'm an academic who sat in the advisory group. I don't sit in the corridors of power. I don't chat to ministers. I don't know. I genuinely don't know what was going on. In our advice, we said to them, the key issue here, as everywhere else, is to do things in an overall context of everything you do, of showing, of building trust. Now, one way you could build trust, for instance, would be for ministers to acknowledge the fact that this is complex and this is difficult, and people are right to have questions. And then to build in processes where people can ask those questions. And also the types of initiatives I spoke about that happened in Israel, not just in Israel, they happened in the UK as well, actually working with black health workers to build those structures of engagement. And the final point is, in many ways, actually you do far better not if a minister gets up, but if a respected member of a community gets up. If an imam, for instance, says to you, it is perfectly legitimate to take a vaccine, at particular times of year and so on. Work through communities. And the way you pose the question, what does a Scottish minister do, in a sense presupposes it's for Scottish ministers to do it themselves rather than to engage and facilitate communities doing things for themselves.
You talk about the need to build trust, but in your statement you also, of course, it's in terms of compliance, there are two sides to it, isn't there? There's building the trust, but then people being able to actually comply with the guidance or the rules and things happening. So
let me start off with the word compliance, because the problem with compliance is it's a very top-down term. You will comply with what I do, right? Whereas actually it has to be much more of a dialogue.
Well, let's take it in stages, because I need to take this quite shortly, and I don't.
No, I
apologise for the timing, but I do need to just sort of take it in stages. You have the need. You mentioned in your statement about the need for support quite regularly throughout the statement, and I won't take you to all the references, but I'll take you to one in a moment. But it's right, isn't it, that the reality is, irrespective of the communications and the trust that can be built up, there will always be people who simply, as you say in your statement, as a result of the lack of support, are just not able to comply, or not able, whether the word comply is or adhere, and that cuts then into the way decision making is made, is undertaken, because, for instance, if you don't have sufficient funding, support, money in the bank, as it were, and you know that if you get a test and you test positive, you have to self-isolate so you can't go to work, you might be less likely to take the test in the first place. If, because you are unable to, you don't have the money in the bank to buy your groceries at the end of the week, you might not be able to go into lockdown because you're with a positive test, with self-isolation, with a positive test, because you will say you can't afford. Now, in terms of the legality, the use of laws, in your statement you say the laws have, the imposition of legislation is actually quite helpful in a lot of regards. But the simple point, or the simple question I want to ask is, in circumstances where you say at paragraph 125 of your statement that the Scottish Government did little to heed the continuing calls for enhanced support, so effectively the carrot, as it were, in the presence of those people who are not complying with that legislation are likely to come from sections of society, lower socioeconomic groups, perhaps less engaged in the trust process as well. So in circumstances where the laws can mandate behaviour and punish non-adherent behaviour, is there not a very strong risk that there will be an unequal, disproportionate impact on groups who are less able to comply with the laws than general public?
So that's a wonderful question, and you need to be careful. You're turning into a behavioural scientist. If you're not careful, you'll be up here. I learned many things during the pandemic, and one of the pleasures of being involved in the advisory process was learning by the other experts. And when it comes to behaviour, my focus has always been on the motivational dimension. Okay, so what is it that makes people want to adhere, to do things? And I've talked a bit, probably too much, about that today. Others point to the fact that adherence depends upon three things. It depends on motivation, certainly. It depends upon, in a sense, having the capabilities, the information, so you know what to do. And it depends critically on the opportunity, the support to do it. So early on, there was a study, I think it was in the spring of 2020, which showed that ethnic minorities and deprived groups are 3 to 6 times more likely to break lockdown. Nothing to do with motivation. Nothing to do with motivation, everything to do with the difficulties of more deprived and marginalised groups to stay at home and put food on the table. So support was critical. And it was critical from day one of the pandemic. So on day one of the pandemic, a new word entered the vocabulary, the word COVIDiots. It was the first time it was used. And this was the problem of people going out and congregating in parks. And if you remember, photos of people in parks and COVIDiots, look, they're congregating. Now, number one, those people were told that they were allowed to go out. Number two, if you're in an urban setting and you don't have your own garden, the only place you can go out is the local park. And if there aren't enough parks, then you're going to crowd. So what is your response? Is it to call people COVIDiots, you're an idiot? Or is it to say, actually, let's support people to be able to do something that's good for health, to go out, and be distanced by opening more public spaces. SPI B, and I myself argued time and again, support people. Support people so they can do what you're asking. And it has a double benefit. Number one, it allows them to do it. But number two, if I ask you to do something which you can't do because of your practical circumstances, all it does is it alienates you from me. It says, these people making the rules don't understand our lives. They tell us to do these things and we can't do them. So it undermines that social relationship fundamentally. So the issue of support, time and time and time again, was absolutely critical. And time again, we weren't given enough support. So the key issue here, because it's a key issue, as you've heard from many witnesses, was self-isolation. The whole point of the testing system, the billions spent on it, was not to test people, not to trace contacts, but to get people to self-isolate. And if you didn't get them to self-isolate, you were wasting your money. Okay. Now, the figures showed that people did quite a lot of things, and they adhered very highly in some areas. If you looked at the figures on self-isolation, it was as low as 18.2%. And the reason for that is it's an extremely difficult thing to do. And after saying support, in the end, the UK government brought in a scheme, the £500 scheme, right, which A, was a small amount of money, B, only 1 in 8 workers qualified for it, and C, 67% of people who applied didn't get it. So it was a tiny amount of support. In other places, like New York, they had a wraparound system, whereby not only did you give people more money, you offered them hotel accommodation, you even offered them support to walk the dog, because that's quite important. If you're isolated, what are you going to do? So there was a critical need for support. Now, the Scottish government did a little bit more, but it didn't do enough. Now, whether that was an ideological issue or a financial issue, that given the financial settlement they couldn't afford to do it, I don't know. But I would argue that if I look at one of the major failures in Scotland, but in the UK as a whole, we didn't give enough support. And I just want to make one final point very briefly. Right? Jeremy Hunt, before he has his present exalted position, was chairing one of the parliamentary committees. And he asked Matt Hancock the question that we've been asking: why was more support not given for self-isolation? And Hancock's response was because we were afraid that people would game the system. So again, this disrespect, this lack of confidence in people as being immoral and intellectually disabled stopped us doing them. I wouldn't say the one thing, but an absolutely critical thing we should have done in order to make adherence higher in the most critical area of adherence.
And to be absolutely clear, you were giving that advice to Scottish Government through SCAG on a regular basis, weren't you?
You've already pointed out that at times I'm like a stuck record, and we were like a stuck record on SPI B. If I give you every quote when we talk about isolation, it would be that long, and the same would go from the Scottish government, from the Scottish Advisory Group.
Thank you. Just bear with me for one moment, please. My lady, I think my time is up.
Thank you very much, Mr. Alledged. Thank you very much, Professor. Your passion comes through quite plainly. Thank you for your help.
Thank you.
My lady, I'm going to do some musical chairs now with
Certainly.
Mr. Tariq. Thank you very much.
Sincerely and truly
I do solemnly, sincerely, and truly
declare and affirm
declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Please sit down.
Good afternoon, my lady. May I please call Dr. Pablo Grez? Can I confirm that you prefer to be called as Dr. Grez?
That's correct. Thank you.
Thank you for your assistance to date with the inquiry. There are a few preliminary matters. Could you please keep your voice up and speak into the microphone so that a stenographer can record your evidence? If any of my questions are unclear, please say so and I will rephrase. You've provided a statement to the inquiry dated the 12th of December 2023. The statement is at INQ 000369759, and you'll see that it's on the screen before you.
That's correct.
Is this your statement?
Yes, it's my statement.
Are the contents of this statement true to the best of your knowledge and belief?
Yes, they are.
I now want to turn to your professional background before we get to the substance of your evidence. You're currently a lecturer in public law at the law school at Strathclyde University, is that correct?
That's correct.
And you hold an undergraduate law degree from Chile,
Yes.
a PhD in law from the University of Edinburgh, and a master's in public law from University College London, is that correct?
That's correct.
And you were previously a research associate at Birmingham Law School, is that correct?
That's correct.
During your time at Birmingham Law School, you worked on a project called the Pandemic Review, Right and Accountability in COVID-19, led by Professor Fiona de Londres, is that correct?
That's correct. I was part of a research team.
Who were the other members of the research team?
Well, Professor Fiona de Londra was the principal investigator, and Dr. Daniela Locke, currently at Oxford, and myself were research associates to that project.
If you could keep your pace slower so that your evidence can be noted. That project that you were involved with led to the establishment of the COVID Review Observatory, is that correct?
That's correct.
Are you able to tell me about the COVID Review Observatory and the aims of that project?
Yes. So the research project was mainly focused at looking at the ways how the different parliaments in the UK, either the Westminster Parliament, Holyrood, the Welsh Senate, or the Northern Ireland Assembly, to the extent to which they were holding governmental responses to COVID pandemic to account. There were a set of criteria we were interested in. We wanted to look whether these processes of review were evidence-based, whether they were participatory, and whether they were taking into account the human rights impacts that the responses led by the governments had for the rights of individuals.
We will come to your research shortly, but the project led to a number of publications, is that correct?
Yes.
And I think it's, is it 5 academic journal articles, 20 blog pieces, 16 submissions to the UK Parliamentary Committee inquiries, 6 to the Scottish Parliamentary Committee inquiries, 2 to the Welsh Parliamentary Committee inquiries, and 2 submissions to the UK and Scottish Government's consultation processes. Is that correct?
Yes, that's right.
Can we now turn to your statement? It's at page 3, paragraph 6 to 7. I wanted to look at paragraphs 6 and 7. Paragraph 6 says, and I quote, "In my view, the COVID-19 pandemic is a textbook example of legitimate use of emergency powers, including delegation of emergency lawmaking powers to the executive. A pandemic requires an effective, fast, and flexible response that keeps pace with the ever-evolving nature of the virus. The legislative process is designed to slow the pace of lawmaking by requiring a series of readings that prompt reflection, debate, and improvements in the quality of legislation. Hence, the normal pace of the legislative process may not be suited for situations of emergency, although, as I explained below, an emergency may evolve, thus enabling a more paused lawmaking process. A framework of emergency powers must strike a balance between the need for an effective response to the emergency and the demands of constitutional principle. Among the latter is a requirement to secure parliamentary scrutiny of the governmental response. Parliament must hold the government to account for its COVID-19 policies, for instance, to ensure that the response is evidence-led, that whenever reasonably practical to do so, the government has consulted with relevant stakeholders, and that it fulfills the human rights requirements, while also not having a disproportionate and unequal impact on those rights." At a very kind of high level, what purpose does parliamentary scrutiny of the government serve in our democratic system?
Well, the starting point is that in this jurisdiction, this is a jurisdiction that abides by the idea of a constitutional democracy, and Parliament performs a key role in legitimizing the exercise of powers in this jurisdiction, either exercised by Parliament itself or by any other bodies, including certainly the executive. It is the role of Parliament to hold ministers into account for their policies, their expending, and the implementation of the policies. And that certainly takes place in the context of normal circumstances, but it should also take place in the context of exceptional circumstances, such as a pandemic.
In the context of exceptional circumstances, can the balance between the need to pass laws fast and the need for Parliament to scrutinise those laws change over the course of, say, a pandemic?
So when we are in the context of an emergency, there might be competing considerations at stake. Although we might want to protect to the extent that is possible the idea of parliamentary accountability, compromises might be needed in order to accommodate the situation of urgency. Our view in the COVID Review Observatory, after looking at the literature, the evidence, and the way how the pandemic developed through time, is that the balance between these considerations of expediency and effectiveness on the one hand, and constitutional principle on the other, is dynamic. We know that pandemics manifest themselves in waves, and there are moments where the virus spreads quite quickly and moments when that spread is more slowly, and there is room for their freedoms. Using an analogy, we could say also that this balance also manifests itself in waves, and at different stages of the pandemic, you can have different balances. We argue that at the very initial moment of the emergency response, the balance quite heavily shifts towards the need for an effective, fast, and flexible response. And therefore, unfortunately, there might be a compromise in terms of the level of scrutiny that Parliament MSPs or MPs might be able to perform. But our view is that as we go along in the pandemic, as we gain further knowledge of how the pandemic develops, as we gather further evidence, as we learn from our previous responses, this situation of emergency can shift towards a situation of crisis management. And in the crisis management, the demands of constitutional principle might weigh more significantly than those of effectiveness and flexibility.
So, at the initial stage of the pandemic, at an emergency situation, the balance between the need to enact fast legislation, the balance might be different in terms of with the constitutional principles of parliamentary scrutiny and oversight. But as we move from that initial phase into crisis management, say for instance summer of 2020, the balance perhaps changes, it's dynamic. Do I understand that correct?
Yes, that would be an appropriate summary of what I'm trying to say.
I want to turn to the Scottish Government's legislative response to the pandemic. The response, the Scottish Government's response was enacted by way of primary and secondary legislation. Are you able to explain to me the difference between primary and secondary legislation?
Yes. So both primary and secondary legislation are different forms of lawmaking. From the point of view of constitutional principle, we could say that primary legislation is a superior form of lawmaking because it enables a full scrutiny of the policies that the government is trying to push forward and implement through legislation. Through, as in the statement that you quote was explained, through a series of readings which are designed in order to prompt reflection, paucity in lawmaking, engagement with potential stakeholders or individuals that might be affected by the legislation, and then taking into account all of these contributions as well as the potential impacts that these measures might have on the rights of individuals. By contrast, secondary legislation is a form of delegated legislation, whereby ministers are able to draft legislation and to enact legislation subject to a lesser form of parliamentary scrutiny, or maybe we can also call it a light touch parliamentary scrutiny.
And as far as the Scottish Government's response to the pandemic, the core of that response in terms of public health measures and international travel restrictions, that was enacted through secondary legislation, this being Scottish statutory instruments. Is that correct?
Yes. So in terms of the enabling framework, as you rightly mentioned, there are pieces of primary legislation coming from the UK Parliament, the Coronavirus Act. There are also two core pieces of primary legislation enacted by the Scottish Parliament, and exercising the powers contained in those pieces of primary legislation, the Scottish Government enacted public health regulations, which are those regulations that introduce most of the lockdown measures or any other restrictions that we all experienced, such as mask wearing, restrictions on gatherings, restrictions on businesses, etc., etc. And on the other hand, there was another piece of Scottish legislation, which you also mentioned, the Public Health, etc. Act 2008, which enabled the Scottish Government to introduce measures to restrict international travel from Scotland.
So before we turn to the legislation that was passed, could you describe to me the key milestones in the life cycle of a Scottish statutory instrument, this being the form that was used to enact most of the public health restrictions?
Okay. So we were distinguishing between two types of legislation, primary and secondary. Secondary legislation is legislation where most of the burden is on the shoulders of ministers who have these powers to enact regulations. They are subject to different sorts of procedures, and therefore we distinguish different sorts of secondary legislation. Secondary legislation which is enacted through what is called the affirmative procedure, whereby a minister drafts the legislation and then lays the legislation before Parliament. Parliament has 40 days to approve that legislation or to reject that legislation, and that legislation won't enter into force unless Parliament approves it. Then you have the negative procedure, which is a procedure whereby ministers enact legislation and Parliament has a window of opportunity to reject those instruments, but if they don't approve it, that's okay. It can become law anyways. And there is also the made affirmative procedure, which is a very prominent procedure in the context of the pandemic, whereby ministers are able to make legislation that can enter into force even before Parliament approves it, but legislation that will lapse unless it is approved by Parliament within 28 sitting days.
So you've described 3 types of different procedures that can be used. There's the affirmative procedure, there's a negative procedure, and then the last procedure you touch upon is a made affirmative procedure.
That's correct.
And it's the made affirmative procedure that seems to be most prominently used by the Scottish Government across the pandemic. Is that correct?
Yes.
And I think the made affirmative procedure is described in some of your academic work as an extreme example of light touch parliamentary oversight, even more so than the other procedures. Is that correct?
Yes, and that's correct for a number of complex reasons. These procedures are a bit difficult to understand and digest, but I guess that the simple way to put this is to imagine that a Scottish minister drafts public health regulations which contain a series of measures that, for instance, prevent people from going outside their homes. They must stay at home. And that legislation enacted by a minister can enter into force almost immediately after being made, without the need for Parliament to discuss whether this is an appropriate measure or not, and to either manifest its approval to that decision or its decision to reject that measure. The measure will enter into force immediately and can last for up to 28 sitting days, as I said, unless there is an approval by Parliament.
So the way that made affirmative procedure works is that a minister, and we'll come to this shortly, decides to use that process. The regulations come into force almost immediately without there being a parliamentary debate or a vote. And then within 28 sitting days, there has to be a parliamentary vote on whether to approve the regulations or not.
Yes.
And if the regulations are voted down at that point, they no longer remain in force. Is that correct?
Yes, and you said that our view was that this was an extremely light touch procedure. And the reason for that is that, as you just mentioned, by the moment where Parliament will have a say on this set of regulations, the regulations would have been in place, being enforced, being followed, being in the media for days, weeks, and according to our research, even months before Parliament has an opportunity to have a say about the details of those regulations. And if that is the case, then we might want to wonder what would be the point of parliamentarians voting down a set of regulations that have been in place for days, weeks, and months. If I may expand on this, regulations come to Parliament under the made affirmative procedure as a fait accompli. The police has been enforcing these regulations for a long time. Guidance has been produced in order to illustrate citizens about their duties and obligations under this set of regulations. So it could be that, and it might well be, if the pandemic is evolving quite rapidly that those regulations are about to be superseded by a new set of regulations, or there might be a change in the policy which might require those regulations to be amended. And that puts parliamentarians in a very difficult position. On top of that, parliamentarians might have other substantive reasons to be concerned about amending or rejecting those regulations. It might be that by rejecting regulations, they might undermine the overall response of the government to the pandemic, or it might be that they have a specific point or concern about a certain specific regulation or rule, but they are happy with the overall content of the set of regulations that is put to a vote, and they don't have the power to amend regulations. They can only accept them or reject them as a whole.
I think we'll come to some of the challenges that were faced by a parliamentarian when having to vote on regulations that have been enforced for at least 28 days. But before we turn to that, as far as I'm aware, the made affirmative procedure had been rarely used in the Scottish Parliament up to the pandemic. I think the Scottish Parliament's Delegated Powers and Law Reform Committee says that between 1999 and 2019, the procedure had only been used on average once or twice a year. Is that correct?
That's correct. It was very rarely used, and by contrast, it became the normal way of lawmaking during the pandemic.
And if we are able to turn to your statement, and it's at page 11, paragraph 36. And paragraph 36, and I think you say it became the normal way of making legislation during the pandemic. This says, to employ the made affirmative procedure, Scottish ministers must consider that the regulations need to be made urgently. A similar test applies in section 122, subsection 6 of the Public Health Scotland Act 2008. The test is subjective in the sense that there is no objective threshold or criterion. Rather, it is about whether the Scottish minister thinks there is an urgency situation. On the other hand, during the specified period, and that's for us January 2020 to April 2022, there was no ministerial duty to give reasons, for instance, in the form of an oral statement before Parliament or a set of explanatory notes attached to a Scottish statutory instrument when laid, nor a duty to provide evidence in support of the ministerial assessment. Scottish ministers enjoyed discretion to decide whether, on a given situation, the urgency test had been met. Can we then turn to paragraph 9, which is on page 3, I think, or is it page 4? Page 4. And here you say if we can go to the last 5 lines of paragraph 9, you'll see there's a sentence that begins, the made affirmative procedure applies when a Scottish minister thinks that an SSI, that Scottish statutory instrument, needs to be made urgently. The consistent use of the made affirmative procedure throughout the pandemic indicates that the Scottish Government took the view that there was a more or less constant condition of urgency. In other words, from their perspective, there was never a shift from emergency response to crisis management. If we can take that off screen, thank you. Do you think that the Scottish Government overused the made affirmative procedure throughout the pandemic when there was other procedures such as the affirmative procedure that was available?
There's no easy answer to that question. As far as the enabling frameworks are concerned, the default position is that public health regulations should be made under the affirmative procedure. The made affirmative procedure is only available when a minister takes the view that there are situations of urgency justifying the use of this very exceptional procedure. If you look at the figures that are contained in our sample of Scottish statutory instruments that we looked at and the way how they had been handled and approved, or if you look at the data that the actual this inquiry has gathered, it looks like what was supposed to be under the framework, the exception, became the rule, because there is only one Scottish statutory instrument containing public health regulations that was made under the affirmative procedure. In other words, the made affirmative procedure was the default position almost all of the public health regulations were made under that procedure.
I think you've touched upon the research that you carried out. Can you explain to me, I think it was a sample size of 64 Scottish statutory instruments that you looked at. Can you explain to me how those were selected and which period they covered during the pandemic?
So we covered, since the very beginning of the pandemic, I think that the first instrument dates from the 26th of March of 2020 until I think that the end of November of 2021. And throughout that period, we were only looking at how lawmaking had taken place in terms of the public health regulations made under Schedule 19 of the Coronavirus Act 2020, which are what we could call lockdown regulations or, in general, restrictions to individual liberties.
Of the 64 regulations that were within your sample size, how many had been made affirmative procedure?
63.
I think we've already touched upon the discretion that the Scottish ministers had to use the made affirmative procedure. What was the Scottish Government's practice towards providing reasons for using this made affirmative procedure during the pandemic? And did that practice change as we moved into 2021 and into 2022?
There was no statutory duty to provide a statement of reasons, as you mentioned, justifying to Parliament why there were reasons of urgency, justifying the making of these instruments through the made affirmative procedure. There was a practice, although not consistent, of a Scottish minister providing a letter to the presiding officer of the Scottish Parliament with a brief indication of why it was, on the view of the Scottish ministers, justified to make those instruments through the made affirmative procedure. But there was not a statement that was attached to the instrument itself. The Delegated Powers and Law Reform Committee took the view that throughout the period of the pandemic, at least 5 statutory instruments had been made through the made affirmative procedure without a clear justification as to the necessity of using this very exceptional procedure. So here is one indication from Parliament that there might be instances where it was not justified. From our point of view, the very fact that there are alternative ways of making statutory instruments that are more respectful of the opportunities for Parliament to hold the government to account for its policies in the pandemic, that very fact suggests that a different approach could have been taken at different stages of the pandemic. In particular, we do understand the necessity of exercising the made affirmative procedure at the very early stages of the pandemic, but as we go through the pandemic, we think that there were less compelling reasons for exercising the pandemic, which, even though might satisfy the view of the Delegated Powers and Law Reform Committee, maybe from the point of view of constitutional principles weren't sufficiently justified. If I can give an example of this, when the Scottish government publishes its policy frameworks outlining new strategies for approaching the pandemic, that provides a broad indication of what the direction of travel in terms of coronavirus regulation might be for the future, and therefore it would have been desirable that once the policy had been designed, also draft instruments could have been provided to Parliament, because eventually it would be through a draft, through a statutory instrument, that those broad policies would be implemented in detail. This is not only our view, this is also the view of parliamentary committees at the UK Parliament.
We've touched upon the 28-day period. What did your research show about whether there was, in fact, a 28-day period by which the regulations were brought before Parliament for a vote, or was it often more than 28 days?
So we took this sample of 68 statutory instruments, and we identified certain milestones in the life cycle of a statutory instrument, being those when the instrument is made, when the instrument enters into force, when the instrument is approved and debated, if it is debated. And what we found in terms of your question is that only there were very, very exceptional circumstances where the Scottish government did not comply with the 28 sittings, 28 rules, 28 days rule. A different question is whether there was always adherence to the spirit of the rule. The spirit of the rule is to bring those statutory instruments to a parliamentary vote as soon as it is reasonably possible to do so. And there were instances where that didn't happen.
One of the issues I think you've raised in some of your writings is the risk that that it's possible to chain regulations together, so that by one extending the expiry dates of the other, so in effect you have one regulation which is due to expire on a certain date and it requires a vote, and then it's superseded by another set of regulations which extends the expiry date, so the concrete set of regulations or rules remain in force for longer than the 28 days by chaining regulations together, and all of this being without subject to a parliamentary vote. Are you able to explain that concept in more detail?
Yes. So we will have to imagine a situation where a Scottish minister makes a set of regulations in day one, and from that day, that set of regulations will enter into force potentially immediately or at a day that the minister might designate, but it will have to be approved by Parliament before 28 sitting days. Otherwise, it will lapse and it will no longer be in force. We identified one situation where that had happened, and before that 28 sitting days period had lapsed, and before that instrument had been approved by Parliament, a new instrument, Instrument 2, had been made which extended the lifespan of the first instrument. And therefore, the 28 sitting days period will be reset. And it will be a new 28 sitting days period that will be operating now. So potentially, theoretically, one weakness that this finding unveils is the possibility of constantly evading parliamentary scrutiny through enacting a set of regulation and then extending the expiry date of that set of regulation through different new regulations that will renew the 28 days period. We don't argue that this possibility was abused by the Scottish Parliament, by the Scottish government, I'm sorry. There were specific reasons why that had to be the case in that specific example that you mentioned. However, it does indicate that there might be a weakness in the procedure itself that might need to be dealt with in future legislation.
I now want to turn to the issue of debate. So when one of these regulations is brought before the Parliament, can we turn to page 17 of your statement at paragraphs 56 and 57? So if I can read paragraph 56. The made affirmative procedure had a significant impact on the Chamber's ability to retrospectively scrutinise public health measures, when motions to approve Scottish statutory instruments were moved, MSPs were asked to consider public health regulations that had been enforced for weeks, if not months in some cases. By the time the vote took place, the Scottish Government had already published guidance to communicate the contents of the regulations to the public, which was further communicated by the media. Hence, people, business and workplaces were abiding by these regulations and the police enforcing them. For this reason, at the CVRO, we argued that Scottish statutory instruments made under the Made Affirmative procedure came before the Parliament as a fait accompli. I think there may have been other reasons why MSPs refrained from voting against Scottish statutory instruments. For instance, MSPs could take the view that voting down a Scottish statutory instrument could confuse the population, as it would require a new set of regulations to be put in place very quickly. It could undermine the overall pandemic response and the trust of the public in governmental decision-making, and/or it could be that they only had specific objections concerning some but not all of the rules enacted by a set of public health regulations, and an all-or-nothing vote on the Scottish statutory instrument did not accommodate those distinctions. The final point there is when it comes to a vote, there isn't an ability to amend the regulations, is there?
That's correct.
So it's a binary choice that you either vote to keep the regulations in force or you vote to withdraw the regulations. Is that correct?
That's correct.
In your research, in the sample size that you used of 64 Scottish statutory instruments between March 2020 and November 2021, were any of the Scottish statutory instruments made using the Made Affirmative procedure voted down by a majority of the Scottish Parliament?
No. Our finding is that during the pandemic, Scottish statutory instruments containing public health regulations were virtually invincible because they would never be voted down.
And I think in your research, it shows that only 9% of the regulations in your sample size were debated in the chamber of the Scottish Parliament. Is that correct?
Yes, that's correct. Regulations containing public health measures were very rarely debated. For a regulation to be debated, there will be a need for an MSP to raise a point of concern about the broader policy containing that set of regulations or about the content of the regulations themselves. And there were a few examples of MSPs concerned about the procedure as a whole and trying to make a point by promoting a debate.
In the 9% of these regulations in your sample size that were debated, what was the typical length of the debate?
Well, debates were quite short. They would last between 5 to 10 minutes.
And I think you say in your statement that in total, the Scottish Parliament spent 35 minutes debating the 64 statutory Scottish statutory instruments. Is that correct?
That's correct.
So that's 35 minutes debating the regulations in your sample size that were passed between March 2020 and November 2021.
Yes, that's as far as the chamber is concerned.
The inquiry understands that from autumn 2020, there were concerns about the lack of parliamentary oversight of the regulations that had passed. Particularly, these are regulations pertaining to the first wave of the pandemic from March 2020. And parliamentary and government officials engaged in conversations to enhance parliamentary scrutiny. What package of measures were introduced from autumn 2020 to tip the balance more towards parliamentary scrutiny?
So there were two main types of measures. The first and maybe the more important one, I will say, were those that were trying to design or craft a system that will enable MSPs to conduct what we could call pre-enactment scrutiny of statutory instruments made under the Made Affirmative procedure. And the dynamic that was agreed was one where the Scottish Government will commit to make a policy announcement regarding public health regulations on a Tuesday afternoon. Usually they will reconsider whether changes were needed on that very Tuesday in the morning. then they will make available to Parliament a draft set of regulations that will be later be made under the made affirmative procedure on a Wednesday. Then Scottish ministers and senior civil servants will be made available to attend a session at the either COVID-19 committee or the COVID-19 recovery committee, depending on whether we were in session 5 or 6 of the Scottish Parliament, to give evidence and answer questions arising out of this draft set of regulations, which would be then made into law either on a Thursday evening or on a Friday, and might potentially enter into force the next day.
So could you explain in a bit more detail the role of these committees, this being the COVID-19 Committee of the Scottish Parliament, which then later became the COVID-19 Recovery Committee, in terms of parliamentary oversight?
The Scottish Parliament, being an unicameral parliament, relies quite heavily on the contribution of its select committees to perform scrutiny not only of policies and its implementation, but also of legislation. And the scrutiny of primary legislation and certainly of secondary legislation relies significantly on the work that these committees perform. The Delegated Powers and Law Reform Committee performs technical scrutiny. It looks at the virus of the instrument. It looks at any other technical issues that might arise, such as lack of clarity and aspects of a similar nature. And then there is a lead committee, which is usually the one that, in terms of the policy, matches the remit of the committee, which will look at the policy implemented in that instrument. During the pandemic, the Scottish Parliament decided to create a bespoke COVID-19 committee, which will look at the policies in terms of the pandemic, and it was that committee, the one that was in charge of scrutinizing those instruments in more detail.
There's a particular instance of the Scottish Government's use of the made affirmative procedure which I want to explore with you. In summer 2021, the COVID-19 vaccination certificate scheme was being considered, and the certificate scheme policy was announced in Parliament by Nicolair Sturgeon on the 3rd of August 2021. Then on the 9th of September 2021, the Chamber in the Scottish Parliament debated for around 2 hours a motion on the COVID vaccine certification scheme. And the motion provided very broad guidelines on how it was proposed that the policy would work. And in addition, the government had published, I think it was a plan or strategy with the proposals. So it was at a very high general level about how the policy would work. And the debate was a clear indication that the proposal was fraught with difficulties, because the Scottish Conservatives, Scottish Labour and the Liberal Democrats all voted against the motion. However, despite this being an issue that was fraught with controversy and difficulty, the Scottish Government used the made affirmative procedure on the 30th of September 2021, and the regulations came into force on the 1st of October 2021. And I think speaking about some of the improvements that had been made to parliamentary oversight, the government had shared a draft of the regulations with members of the Scottish Parliament to scrutinise only 1 day in advance of the regulations being made. That was the 29th of September. So what we have here is a policy announcement made on the 3rd of August 2021. There seems to be quite a lot of political controversy. And then the regulations are introduced using made affirmative procedure. And they're introduced, that's the operational regulations with all the details of how the scheme would work in practice, all without an ability of the Scottish Parliament to debate the details of the policy. What was the urgency that between the 3rd of August and the end of September that required this procedure to be used as opposed to, for instance, the affirmative procedure?
Well, the example that you provide is a case in point of the tensions that in terms of parliamentary scrutiny arose, and the dissatisfaction that at certain points in time, rightly, members of the Scottish Parliament had towards the way how lawmaking was taking place in the pandemic. There had been a policy announcement more than a month in advance of the detail of the implementation of that policy being put to Parliament. And there was also, as you say, a debate on the policy, which had been preceded by a publication of a more fully fledged policy document outlining the content of the policy. And the Scottish government was aware of the fact that there was some dissatisfaction, certainly among certain political parties in the Scottish Parliament represented, over the policy. So it is hard to understand why those regulations containing the details of that policy that had been controversial had not been shared in advance with the COVID committee and other members of the Scottish Parliament. What you mentioned at the very end shows that what they did was to apply the measures, the enhanced scrutiny measures, but it was clear that a different approach was possible because that policy had been worked out by weeks at that time.
Overall, should the made affirmative procedure be used or exercised with caution and self-constraint because of the extremely light touch parliamentary scrutiny that exists if you use that procedure?
I would agree with that claim. I think that the governments in general should exercise more caution when deciding whether to make certain sets of regulations through the made affirmative procedure or whether to opt for a different procedure. In fact, you were referring to the example of the COVID certificate scheme. When the COVID certificate scheme was amended, since it had been controversial, those amendments were introduced through a statutory instrument that was made under the affirmative procedure. And although there were still certain considerations of urgency that needed to be taken into account, an agreement was reached between the government and the COVID-19 Recovery Committee to have an accelerated timetable to introduce those amendments through the affirmative procedure. So the standard affirmative procedure provides 40 days for Parliament to approve regulations in draft. In this case, it was agreed that it will have only 4 days.
Before we turn to lessons learned, in the context of a pandemic where the government and then parliaments are having to consider legislation that was perhaps some of the most draconian that people have ever had to live through, is that the sort of scenario where, in fact, even more caution and self-restraint is required, which comes with more parliamentary debate, so that better legislation can be passed that is evidence-based?
I will go back to the idea that there needs to be a compromise, and we need to look at on the ground what the circumstances are in order to assess whether we need an emergency procedure for the making of legislation in a given context and circumstance. There might be circumstances where we need a rapid response, where the virus is evolving too quickly, or there are many uncertainties, and therefore there is justification for using the made affirmative procedure. There might be other situations where that might not be the case. The made affirmative procedure should be on the toolkit, I would argue, but as you said, should be exercised with caution.
And I think that's a distinction that you've made between the initial phase of the pandemic and then moving into the crisis management phase, where there is a little bit more time and scope to have better parliamentary scrutiny. Is that correct?
Yes.
And I want to finally turn to lessons learned. And the Enquiry understands that from June 2022, the Scottish Parliament passed the Coronavirus Recovery and Reform Scotland Act 2022, which reflects some of the lessons learned during the pandemic. Are you able to outline the main changes that now exist from the legislative framework that existed at the start of the pandemic?
So during the first semester of 2022, the Scottish Parliament had the opportunity to discuss different ways of improving the enabling framework. It was a decision of the Scottish Government to make the powers granted by the UK Coronavirus Act part of Scottish legislation for future pandemics. And in the context of introducing that legislation, some improvements were made. The first and maybe more noticeable improvement is to demand from Scottish ministers in the future to make a statement of the reasons that support the urgency of making regulations under the made affirmative procedure, a requirement that was absent during the pandemic and that the COVID-19 committee advocated very strongly in favor of. On top of that, to trigger these emergency powers, now the Scottish government has to do a declaration of public health emergency, which is subject to a vote in the Scottish Parliament. So now there needs to be a say for MSPs in order to trigger this set of emergency powers. And there are duties to consult relevant stakeholders whenever it is feasible or possible to do so before enacting public health regulations. And finally, wherever Scottish ministers exercise their powers to make public health regulations under the made affirmative procedure, there is a duty to introduce a sunset clause so that the regulations expire at a certain point in time.
So you would welcome all of those changes in terms of striking a better balance. In your statement, I think you say that your view remains that more can be done to achieve a better balance in use of these procedures in a future emergency situation. I think you identified two alternative pathways which you recommend for consideration. The first is in terms of preparing for a future emergency, to amend the statutory framework so that different levels of public health response are outlined in primary legislation with delegation to trigger these powers through secondary legislation. Can you explain that suggestion in more detail?
So I think that during this inquiry, a lot has been spoken about pandemic preparedness from the point of view maybe of material resources, but maybe we can also think about pandemic preparedness for the future in terms of legislative and regulatory measures that might be in place in the future. A lot has been learned in terms of what are the sort of broad responses or broad principles that should govern the emergency response for future pandemics. And perhaps there is therefore an opportunity to not only improve our procedures, but also to give Parliament a say or an opportunity to reflect on how the substantive response should look like. And we envisage at least two ways in which that could be possible. One way would be to incorporate into primary legislation some core elements or principles of, for instance, a tier system of lockdown regulations, certainly providing certain flexibility for the government to tailor the specificities of that response to the circumstances that are at hand, or alternatively, to draft future public health regulations that are subject to scrutiny. We have some information that the Coronavirus Act took some elements of legislation that had been drafted in the context of a SAGNUS exercise. So perhaps a similar effort can be made to draft regulations. Or alternatively, we can think of different ways of accommodating the affirmative procedure to a more constrained timetable, but providing an opportunity for Parliament to have a say before regulations are made and enter into force.
Your second recommendation was to incorporate a ministerial duty on the exercise of emergency powers every 2 months. Are you able to explain that proposal?
The Scottish government developed a quite robust, I will say, practice of reporting on the exercise of the powers under the UK Coronavirus Act and the two Scottish Coronavirus Act. Those reports provided information of what measures had been taken, how many statutory instruments had been made, when they had been made, what evidence had been taken into account to support those measures, and also, I would say also a significant engagement with the human rights impact of those legislation. Each of those reports were under publication by a statement made by a relevant senior member of the Scottish Cabinet to Parliament, which would introduce very briefly what the content of the report was, and then there would be opportunity for questions. And on top of that, the COVID-19 committee had the opportunity to scrutinize in more detail those reports. Parliamentary accountability, to be possible, it needs to be enabled by the government. Transparency and information about what the evidence is, what the impacts of the measures are, etc., are essential to enable MSPs to hold the government to account. And in that sense, I think that this was a practice that should be kept in mind and should be operating in future pandemics because it was of a good quality.
My lady, there's no further questions from me. I understand there's no live Rule 10s. So on behalf of the inquiry team, I can just thank you, Dr. Grace, for your evidence today.
Thank you very much, Dr. Grace. Very helpful. Thank you. I shall return at 3:15.
Good afternoon. May I please call Professor Susan McPhee?
Stand for me, please, and repeat after me. I do solemnly, sincerely, and truly
I do solemnly, sincerely, and truly
declare and affirm
that
the evidence I shall give
the evidence I shall give
shall be the truth,
the
whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Thank you. Please sit down.
I hope we haven't kept you waiting too long, Professor. I'm very sorry if we have.
Not at all.
Good afternoon, Professor McPhee. There are a few preliminary matters I wanted to touch on. Can you please keep your voice up and speak into the microphone so that your evidence can be recorded by the stenographer? Is that okay?
Yes, that's fine.
And if there's any question that I ask which is unclear, please say so and I will rephrase or repeat the question. You've provided the inquiry with a witness statement dated the 15th of December 2020, the 12th of December 2023. The statement is at INQ 000369767. You have the statement on screen. Can you confirm if this is your statement?
Yes, it is.
Are the contents of this statement true to the best of your knowledge and belief?
Yes, they are.
I now wanted to turn to your professional background, Professor McPhee. As I understand it, you're a professor of quantitative criminology in the School of Law at the University of Edinburgh. Is that correct?
That is correct.
And you've held that position since 2010. Is that correct?
Yes.
I know about criminology, there's a surprise, but quantitative criminology, what's the difference?
Well, I mainly focus on large research projects involving quantitative data, large administrative data sets, surveys, that sort of thing.
And I anticipate coming to some of that data.
Okay. Sorry if I preempted your questioning, Mr. Terry.
Prior to this, you were, I believe, a research fellow and then senior research fellow in the criminology branch of the Central Research Unit in what was at the time the Scottish Office and is now the Scottish Government between 1992 and 1997. Is that correct?
That is correct.
And then you became a senior research fellow at the law school at Edinburgh University from 1998 before you ended up in the position that you currently hold. Is that correct?
That is correct.
So you've had over 25 years of experience in academia. Is that correct?
Yes.
And you have many publications in the field of criminology, including policing policy and practice and crime trends and patterns. Is that correct?
Yes, that's right.
And you've been involved in many advisory committees for governments in Scotland, the wider UK and internationally. And this includes membership of 2 prior independent advisory groups on Scottish policing on the topic of stop and search powers and police use of biometric data. Is that correct?
That is correct.
And in the context of the pandemic response, you became a member of the Independent Advisory Group on police use of temporary powers related to the coronavirus crisis in Scotland from the inception of the group in April 2020. Is that correct?
That is correct.
And you remained in the group until it was formally disbanded in May 2022. Is that correct?
Yes.
We are going to come back to the work of the Independent Advisory Group, but you're also the principal investigator for a research project titled Policing the Pandemic in Scotland. Is that correct?
Yes.
Are you able to tell me about this particular project?
Of course. The project arose out of the work that I'd been doing for the Independent Advisory Group, where I had been tasked with using police data to analyse patterns and trends and the characteristics of individuals who'd been subject to enforcement. At the time, there was a funding opportunity for rapid response projects that would be used to help inform policymakers and ministers about the impact of the pandemic. So I was fortunate enough to receive funding and I conducted research with a small team of colleagues looking at a detailed analysis of the data that we had around police use of enforcement in Scotland. We conducted interviews with a number of police officers and we conducted interviews with a small number of members of the public who'd been issued issued with fixed penalties, but that particular piece of research didn't work very well because we didn't have very many people willing to take part. But we've also done research that involves linking police data with health data, which has allowed us to look in a bit more detail at the underlying health vulnerabilities of those who were subject to enforcement.
I will come to that piece of specific data shortly, but I think you've said that in the context of your project, you've interviewed members of the police. Is that correct?
Yes.
And was that in relation to policing during the pandemic?
Yes.
And this is in the context of Scotland, is that correct?
Yes.
Do you know roughly how many police officers you would have interviewed in the context of that project?
I think we interviewed around 30.
And you're also, and we'll come back to the project, but you're also, in terms of your current roles, are you a consultant to the National Police Chiefs Council on the police use of enforcement in England and Wales?
I was given a consultancy to do work on producing a report for them on their data on police use of enforcement, yes.
Having set out your background, I wanted to turn to the Independent Advisory Group. This is the Independent Advisory Group on the police use of temporary powers related to the coronavirus crisis in Scotland. And this advisory group was established by a Scottish Police Authority at the request of the Chief Constable of Police Scotland. Is that correct?
Yes.
Are you able to explain to us the difference between the Scottish Police Authority and Police Scotland?
So the Police Service of Scotland is the single unitary police force for the country. It was previously 8 legacy forces which were merged together into one single force in 2013. And at that time, the Scottish Police Authority was established as the scrutiny body to examine police activity, police use of its powers, and to monitor how policing was being operationalised and developed in Scotland.
So this independent group was effectively set up by this oversight or monitoring body, this being Scottish Police Authority, is that correct?
Yes, the Scottish Police Authority provided the secretariat to the group, and the Independent Advisory Group reported back to the SPA, but Police Scotland were very core participants in the group.
In general terms, what was the remit of the group?
Our terms of reference were specifically to look at the police emergency powers that had been issued, so the powers of enforcement, and we were asked to examine the policing of the pandemic in the context of human rights, and also to ensure that enforcement had been administered in line with policing values and principles in Scotland.
Why was there a need for this group?
I believe that the Chief Constable, of course, I mentioned that Police Scotland had only existed since 2013, and in its short lifetime, there had been a number of fairly high-profile inquiries into specific aspects of policing, including 2 advisory groups that you've already mentioned on stop and search and police use of biometrics and data. I think the Chief Constable was acutely aware that it was likely there would be scrutiny around police use of these new extraordinary powers, because the police were being asked to enforce activities that under normal circumstances would be completely law-abiding behaviours. So he was keen to ensure that there was an independent group that would provide scrutiny, public transparency, and enable the organisation itself to learn from any aspect of the policing work that was being undertaken.
So one of the purposes was to effectively learn in real time what was happening and what could be improved during the pandemic?
Yes.
Who were the other members of the group?
The group was chaired by John Scott Casey, now Lord Scott, and he invited a range, or in fact, it was David Crichton, who was the Chief Executive of the Scottish Police Authority at that time, invited a range of individuals to join the group so that it would have quite a broad membership. Do you want the exact list? Because I can refer to my notes for that, or I can try and remember them off the top of my head.
I don't need a complete list. It was just trying to get a range, what range of experience or expertise was on the group.
Okay, so Police Scotland and the Scottish Police Authority, I've already mentioned. There was a representative from Public Health, a representative from the Crown Office, the Crown Agent sat on the group. The Chief Inspector of Constabulary sat on the group. There was membership from a range of third sector organisations, including the Glasgow Disability Alliance and Scottish Women's Autism Network, and there were representatives from a number of human rights and equalities organisations, in addition to myself, and Mr. Anwar was a member of that group.
How frequently did the group meet during the pandemic?
In the early days of the pandemic, it met very frequently, at least twice a week, sometimes more frequently than that if there were specific issues to be discussed. Over time, we met less frequently, although at least once a week, up until around the end of 2021, and then beyond that we met a bit less frequently until the group was formally disbanded in May 2022.
Did the group receive regular updates or input from senior police officers about some of the issues that they were facing during the pandemic?
Yeah, excuse me. Yes, it did. Deputy Chief Constable Will Kerr attended certainly regularly at the beginning of the pandemic, a bit less so later on, but he was a frequent attender. And Assistant Chief Constable Gary Ritchie was present at the vast majority of meetings. There was always a police presence. We quite often had senior representatives from different divisions as well, usually at Chief Superintendent level. And we were also furnished with a secretariat called the Optical Group. Don't ask me to repeat what Optical stood for because I've forgotten, but it was essentially a group that was providing us with data, information or any intelligence that we needed in terms of our work.
How did the group report its findings or recommendations to the police?
We, internally within the group, we produced a number of reports. Different members of the Independent Advisory Group produced reports on specific themes. I, for example, produced quite a number of data reports. And the chair of the group, Lord Scott, was responsible for reporting back to the Scottish Police Authority. So all of the work that we undertook and the detailed reports that were produced by Lord Scott and any other work we'd conducted, such as some of my data reports, were formally presented to the Scottish Police Authority through their board meetings, and so they were discussed by the SPA and Police Scotland.
In your statement, you explained that I think you say you were the only academic on the group, which meant that you took on a role of amassing evidence and advising on research which could help to inform policing practice. You also say that you examined the police use of these new powers under the coronavirus regulations from an empirical perspective. And I think you say there was a significant amount of data for you to use. What were the sources of data that you used in your research?
So do you mean the research project or the work of the Independent Advisory Group?
The work of the Independent Advisory Group.
In the Independent Advisory Group, Police Scotland had, with a great degree of foresight, I might add, had decided to create a coronavirus intervention system to measure the extent of the encounters it was having with members of the public. In one of my previous groups, I had been involved in advising around the collection of data and the publication of data on stop and search. So having good data and knowing what the data was telling them about their own activities, I think was something that was quite high on their radar. The Coronavirus Intervention System, as it was called, or CVI system, allowed us to analyse the relative use of enforcement compared to other aspects of activity. I can speak to the 4 E's approach later if you wish, but the purpose was to understand to what extent were officers engaging with members of the public around the coronavirus regulations and how often were they resorting to use of enforcement. I also had access to individual level data about individuals who had been issued with a fixed penalty notice. So I had personal information about not about their identities, but about their age, their sex, their ethnicity, that sort of thing.
And all of that allowed you to pull together a series of reports that you produced as a member of the Independent Advisory Group, is that correct?
Yes, that's right.
I want to turn to the use of fixed penalty notices because it's a subject of, I think, significant number of reports that you've produced along with others. And I'm talking about the use of fixed penalty notices in the context of enforcing public health restrictions in Scotland. Just to be clear, a fixed penalty notice is an on-the-spot fine. It's not a criminal conviction, but they are recorded on police systems and may be disclosed via an enhanced disclosure application within a certain period of time. Is that correct?
Yes.
So are you aware of the rationale for using fixed penalty notices as a means of enforcing public health restrictions in Scotland during the pandemic?
Well, I'm aware of the kind of the general rationale for using fixed penalties at the level of why they were considered expedient and a good model. It's less clear what the purpose of the fixed penalties was supposed to be. That's never really been properly explained in terms of if you were to have a metric of success, for example, it's difficult to know what that metric would be. Is it the speed of the spread? Is it the number of individuals who have the virus or who have sadly passed away?
You say that about a lot of the sentencing within the criminal justice system.
Indeed. But in terms of the rationale, it was explained by Kit Malthouse MP, who was the UK Government Minister for Policing. It was explained as a kind of expedient model of using enforcement that would be familiar to the public. It had a number of appealing aspects to it. It has an established level of legitimacy. The public know what an on-the-spot fixed penalty is. They understand it. They accept that these types of penalties exist. As you mentioned, it means you don't criminalise people because you don't get a criminal record. It represents a relatively minimal administrative burden for both the individual who receives the fine and also for the police themselves. And it keeps people out of the criminal justice system, which was important in the context of the pandemic. I think the more people being kept out of the system was considered important. And actually it did, because the data in Scotland specifically show that only 121 people, I think, were subject to criminal proceedings up to March 2022 under the coronavirus regulations, and only 5 went to prison. In relation to why were they used in Scotland specifically, that is because they were proposed by the UK government, and at the beginning of the pandemic, when there was a discussion about the extent and the nature of the regulations that would be put in place, there was a high level of commitment from the Scottish Government to be part of a four nations approach. So they were proposed by the UK Government and they were accepted. There's not really anything in any of the correspondence that I've seen to suggest there was ever any question as to their use.
I think you say in your statement that fixed penalty notices are most suitable for clearly defined objective offences that involve minimum discretion on the part of police officers.
Yes.
One example might be, for instance, speeding.
Yes.
It's a binary issue of whether you're speeding or not. And you say that their use to enforce public health restrictions during the pandemic was a departure from this traditional model. Can you explain why it was a departure from this traditional model?
It was a departure because, as you say, fines are typically used for well-defined, either well-defined low-level offences, including speeding, or they might be used for antisocial behaviour offences, which can be broader, but there's a lot of case law. So there's a good understanding about what is and isn't an offence in relation to antisocial behaviour. The issue in relation to the COVID fines was that the extent to which the fines might be used in the types of behaviour that they might be issued for was not necessarily always clearly defined. It changed a lot over the course of the pandemic as the regulations changed, and it was not always clear to either members of the public or police officers themselves what was a breach of the law and what was merely a breach of guidance, for example. So it was problematic from the point of view that neither the individual nor the police officer might have a clear view of whether an offence had actually been committed.
What would have been the alternatives to using fixed penalty notices as part of the pandemic response?
Well, I certainly wouldn't have advocated for anything further into the criminal justice system. Formal warnings could have been used. We've seen from the data, if you look at trends over time in the use of fixed penalty notices, they've been going down for the last decade or so, both in Scotland and in England. They declined quite markedly by something in the region of 80 to 90%, whereas the use of formal warnings or community dispute resolutions in England have been increasing. So it felt a bit strange for us when we were looking at the decision to introduce fixed penalties, that was against the prevailing trend of summary justice measures in Scotland. But of course, because they were following the English model, then that would explain that, but they've been going down in England as well. So a formal warning could have been used. That has been recommended in some literature in the US, that warnings are a better approach because the vast majority of people only had contact with the police once, and so therefore a formal warning wouldn't have resulted in some of the inequalities that are inherent in a financial penalty.
We will come to those inequalities. In your research, have you seen any evidence as to the additional benefits of using sanctions in addition to guidance, such as in terms of public compliance with the measures?
So we haven't specifically researched that, and it would be quite difficult to research that in the Scottish context because of the blurring between rules and guidance, and because of the multiple changes to the rules over time. It's actually quite hard to disentangle what would have made a difference. The vast majority of countries did follow a sanctions-based model, and I think that probably is one of the reasons that the UK government decided to go down that particular route. There are not very many countries that have focused only on guidance. South Korea is one, but it's a very, very compliant population.
Give the example of, is it Sweden,
yes,
in one of your research that focused not on the sanctions model, but on the guidance model.
That's right. And Sweden is often used as a comparator to Scotland because we're, similar hemispheres, similar population. Sweden decided not to use sanctions. They didn't introduce a lockdown. They banned large gatherings, travel, and social. They recommended social distancing. They didn't lock down the schools immediately. They didn't introduce face masks immediately. They took a much more kind of what you might describe as a lenient approach to managing the pandemic. It wasn't without controversy in Sweden, and many scientists were critical of the government for not introducing some kind of enforcement, and claimed that the lack of enforcement would lead to an increase in the death rate. However, a study that's been conducted fairly recently has identified that the death rate in Sweden was relatively low compared to other comparator European countries, including the UK. It's almost half the rate in Sweden that it was here. So there's evidence. There's no clear evidence to suggest that you need enforcement in order to make people comply. It was considered more of a...
Sorry, yes. You say comparative countries. I mean, I've been down this road before. Comparisons are very difficult to make.
Yes.
Sweden's population probably far more dispersed, don't have the as many major cities where people are densely. It's really difficult to make a comparison between different countries.
Absolutely. And actually the level of social support for individuals who may have struggled to comply in Sweden would have been higher. So, I mean, I think what I would say is it's very difficult to know within the UK context whether a guidance-only model would have worked. But in the event, it was never really considered.
Yeah. In your report, and we're going to come to the report shortly, I think you say it's been very difficult to tease out the effect, if any, that enforcement had on preventing the spread of the disease or saving lives. You say that as a principal reason for introducing new policing powers during the pandemic, this does raise questions about testing the efficacy of an enforcement-based model to reduce the spread of the virus. Does that still remain your view? And if so, can you explain your position?
Yeah, so the position is based on the original statement that was made by Priti Patel MP when the enforcement was introduced, and she made a statement regarding the use of enforcement, and she specifically said that the use of enforcement would help to reduce the spread of the disease, protect the NHS and save lives, which was the kind of mantra at that time. And it's we don't really have the data that would be necessary to try and determine the cause and effect of the use of police enforcement on patterns of death. But I have mapped it, and what you see is that as the death rate increased, the number of fixed penalties increased, and then as the death rate reduced, the number of fixed penalties reduced. So it tracks pretty closely up until about February 2021, at which point the beneficial effects of the vaccine kick in and the death rate drops down quite considerably, but the rate of enforcement continued to be high for another couple of months. There's no evidence that more enforcement led to less deaths and less spread. And in fact, from a logical point of view, the police couldn't know where the virus was or how it was spreading or where it was spreading any more than anyone else could. I think the police role was really more about kind of, trying to mitigate potential negative effects of people being in close proximity together rather than the specific impact on the death rate. I mean, and for example, if a police officer was faced with two individuals, one of whom had a reasonable excuse and wasn't issued with a fixed penalty, and another didn't have a reasonable excuse and was, the officer had no way of knowing which of those two individuals may, if any, have COVID. So I think it was a kind of false impression to link that kind of public health impact with the enforcement itself.
I understand, I'm turning to a new topic, I understand that one of your colleagues on the project sent a Freedom of Information request to the Scottish Government.
Yes.
And what your colleague was seeking to do was looking for correspondence, notes and briefings relating to the decision to include fixed penalty notices as a penalty for breaching coronavirus regulations. I don't intend to take you through each of the pieces of correspondence. You've produced them to the inquiry, but in general terms, what did the correspondence show in terms of the Scottish Government's thinking around the use of fixed penalty notices?
So the correspondence showed that the Scottish Government were committed to a four nations approach. So when the UK Government provided their model of enforcement, the Scottish Government were predominantly interested in considering whether it could be operationalised within Scottish legislation and within the model that operates in Scotland. Information was shared with Police Scotland, with the Scottish Courts Tribunal and with the Crown Office. So there was a view from the criminal justice organisations in Scotland as to how appropriate it was. The main discussions in terms of questions to ministers were around the value of the fine, whether to stick with the existing antisocial behaviour legislation and model the fine around that, whether to retain the value of the fines for antisocial behaviour or adopt the proposed value from the UK government because the values were slightly different, and also there was an issue around the whether fines should be issued to 16 or 17-year-olds, because the UK government had proposed that fines be issued to individuals aged 18 or over, but the anti-social behaviour legislation in Scotland allowed for 16 and 17-year-olds to receive fixed penalties.
I understand from what you say in your statements and looking at some of the correspondence that at the start of the pandemic there was a difference between Scotland and the rest of the UK in terms of, this is Regulation 9 of the Health Protection Regulations in Scotland, that allowed fixed penalty notices to be issued to people aged 16 or over, whereas the position across the rest of the UK was that fixed penalty notices could only be issued to people 18 years or over. And in those documents, that seems to be a conscious decision, a deliberate decision that's made by the Scottish Government to use the existing model of the antisocial behaviour so that these penalties can be issued to 16-year-olds. Is that correct?
Yes. I think the decision to model the COVID fixed penalty on the existing legislation was partly a practical one. The police were used to issuing antisocial behaviour fines, so therefore using the same kind of broad model, it made sense. If they were in a position where they were having to issue some fines to 16, 17-year-olds and not others, I think there was a feeling from Police Scotland that, you know, that would cause some confusion. And also, I think it was expressed in that particular document that Police Scotland were concerned that younger people may pose a problem in terms of being in large groups and potentially spreading the disease. So in some ways, I think Police Scotland had quite a big influence on the decision to maintain to maintain 16, 17-year-olds within the legislation as opposed to the English legislation.
And the inquiry understands that the Coronavirus No. 2 Scotland Act then amended Regulation 9 to raise the minimum age to 16, and that act came into effect on the 27th of May 2020. So within a couple of months of initially deciding to go with the age of 16 years, this was increased to 18 years. And I think in that time there had been calls from the UN to ensure children's rights were being safeguarded during the pandemic in Scotland. And it was thought that this change would bring in line with the UN Convention on the Rights of the Child. Yes. Was that the key driver, the concern from organisations such as the UN, which led to the increase of age from 16 to 18?
I think there certainly was messaging from the UN, but actually the primary driver in Scotland, and I should have meant they'll be upset with me for not mentioning them, the Scottish Children's Commissioner, or the Commissioner for Children and Young People, was quite vocal in the discussion around 16, 17-year-olds. It was having 16, 17-year-olds in the legislation fell out of kilter with the prevailing direction of sanctions for children and young people. We've seen a big change in the way that we deal with children and young people who are involved in offending in Scotland. We have a new whole systems approach. We have a new bill that's been trying to keep 16, 17-year-olds out of the criminal justice system. And the Scottish Government is heavily committed to the UN Convention on the Rights of the Child. So when the legislation was passed and when our advisory group was established, the Scottish Children's Commissioner was quite vocal about the fact that this felt out of kilter with the way that we usually did things. And I think looking at the Freedom of Information documentation that you mentioned earlier, I'm struck by the fact that no equalities impact assessment was conducted by the Scottish Government on that specific issue. I think Joe Griffin, who's already given evidence to the inquiry, has spoken to the fact that there wasn't time to do proper equalities impacts assessments of the legislation as it came in at the start of the pandemic. And that's certainly true. I think in my evidence I produced 2 documents of equalities impact assessment that haven't looked specifically at enforcement. But as far as I'm aware, enforcement hasn't been covered in any subsequent equalities impact assessments. If it had been at the time, I think the 16, 17-year-old point would have been picked up and that wouldn't have been allowed to go through.
And I think you say in your statements that that there's data which shows that there was 256 fixed penalty notices that were issued to people under the age of 18 prior to the introduction or the amendment to Regulation 9.
Yes.
And I think you also say that data also shows that there was a further 220 fixed penalty notices issued to people under the age of 18 after the amended Regulation 9. Why would that be?
I don't know for sure, but I think it's probably, I mentioned earlier the confusion between having one type of fixed penalty notice that can be issued to 16 and 17-year-olds and one that can't. So it may well be that police officers were unaware or had forgotten that the change in the law had been made. If they had already been used to issuing fixed penalty notices to 16 and 17-year-olds, it may just have been an oversight during operational practice. I think the other issue is that it's not always clear at the time when an officer is dealing with a person actually what their age is. So it could well be that it was just that they weren't aware at the time they were 16 or 17. I think it's highly likely, I think it's almost certain that any fixed penalty that was issued to a 16, 17-year-old after the legislation had been changed would have been rescinded.
I wanted to ask you about equality impact assessments. Mm-hmm. In your statement, you say that there's no available evidence to suggest that the Scottish lawmakers gave consideration to equality issues in respect of the decision to use fixed penalties. In Scotland, equality impact assessments published for the Coronavirus Scotland Bill and the Health Protection Coronavirus Regulations 2020 made no reference to the new policing powers or police use of enforcement, nor can we find evidence that retrospective equality impact assessments considered this issue. Had there been equality impact assessments at the time, what sorts of issues would those have identified?
I think I've mentioned the 16, 17-year-olds, they would almost certainly have picked that up. The other issue I would have expected them to have picked up is that in a quirk of the coronavirus regulations, they introduced an incremental fining system. Now, I mentioned earlier that Mr. Malthouse had stated that, introducing COVID fixed penalties was, a known science, that people were familiar with them, that they understood them, that they were easily accepted. And he gave examples of things like littering and dog fouling. What he didn't mention was that under the new incremental fining system issued through the regulations, that if an individual committed a second offence under the coronavirus regulations, their fine would double. If they committed a third, it would double again, and so on, up to a maximum of 5 offences, which would result in a fine of £960. So that is not the kind of light touch, kind of low-level fixed penalty that the public are used to in Scotland or the wider UK. So I would have expected an impact assessment to have picked up on that. You have to also bear in mind at this point there was very little parliamentary scrutiny of regulations. Things were happening so quickly. What we did have in Scotland was the Lord Advocate intervened. So when it was observed that there could be a potential for police officers, and remember, a fixed penalty is an on-the-spot fine issued, in terms of the discretion of the officer. Officers dealing with new regulations, very unfamiliar with them, sometimes making, good faith mistakes. If officers were issuing fines of up to £960, that would have been out of alignment with the level of fine that could be issued with the Procurator Fiscal in Scotland, which at that time was a maximum fine of £300. So the Lord Advocate issued guidance to say that police officers in Scotland could only issue a fine of up to £480, so that's a maximum of 4 fixed penalty notices. And at the same time, legislation went through, I think on the 7th of April 2020, which increased the size of a fine that the Procurator Fiscal could issue as a fiscal fine from £300 to £500. So that brought the police and the Procurator Fiscal powers in terms of their use of fixed penalties into alignment at that point.
I now want to turn to the data that we've discussed kind of in a very high level, and I want to look at the report that you produced. This is the report from the Scottish Centre of Administrative Data Research titled Police Use of COVID-19 Fixed Penalty Notices, and it's at INQ 000369770. So is this a report that you produced for the Independent Advisory Group?
This one, August 22. So the Independent Advisory Group by this time had been disbanded in May of that year. But I continued to work on the data that I had been using as part of the Independent Advisory Group. It was shared with members of the advisory group, and we did have a meeting with some of those members to discuss it.
And we can see perhaps at the top left of the top page is policing the pandemic in Scotland. So this is with your follow-up project after the work of the Independent Advisory Group.
Yes, that's right.
And I think this report analyses over 20,000 fixed penalty notices that were issued by the police to enforce non-compliance with public health restrictions introduced during the pandemic. And I think the data set is between March 2020 and May 2021. Is that correct?
That's right, yes.
Can we look at page 16, figure 3, please? And if we can look at, thank you. You'll see that this breaks down the number of police interventions in Scotland between May 2020 and May 2021 by reference to the 4 E's. Are you able to explain the different stages of escalation? First of all, are you able to explain the 4 E strategy and then the different stages of escalation?
Yes, of course. The 4E strategy was introduced very early in the pandemic, in kind of late March, early April 2020 by the College of Policing and the National Police Chiefs Council, and it was intended as an easy to remember strategy that would minimise any potential negative consequences or impact of the introduction of the new police powers. I think there was a genuine desire by policing organisations to ensure that any impact that policing might have in the context of the pandemic would be as minimal as possible, on the basis that there was an understanding there might be wider inequalities. So the 4E strategy requested that if an officer was to encounter someone that may be breaching the coronavirus regulations, they were to engage with them first and talk to them, find out a little bit about what was happening. If it was clear that the individual was not following the regulations, the officer was to explain, or wasn't aware of what the regulations were, then they were to explain what the regulation was to the individual. If the individual was potentially doing something that was in breach of the regulations, the police were to encourage them to stop doing that and make sure they didn't do that again. And only in the case of individuals who were flagrantly or deliberately or persistently breaking the regulations were they to move to enforcement. So that was the 4E's strategy. And the data that you can see there was extracted from the coronavirus intervention system that I mentioned earlier that was constructed by Police Scotland as a way of measuring encounters. And it takes every encounter that was entered onto the system by police officers and it broadly maps onto those 4 E's. They use slightly different words in the system, but informing people was essentially the kind of engagement and explanation, and then instructing and removing them was essentially the kind of encouragement part.
Can you talk us through what the data shows in terms
Encountered someone under the potential for a breach of the coronavirus, in the vast majority of cases, they relied only on the first 3 E's, so they didn't move to any kind of formal intervention. In around 11.6% of cases, they reported issuing a fixed penalty notice, and in 0.7% of encounters, they noted that an arrest had taken place. So that's around just over 12% of all recorded encounters involved enforcement. So that led us to be confident that the police in Scotland are following the 4Es strategy. It's not possible to compare it with any other police force because no one else measured it, but I think it was a really valuable tool that was introduced by Police Scotland.
So it's 1 in 8
Yes.
roughly interventions or encounters that led to enforcement.
Yes, that's 1 in 8 recorded encounters. I suspect there was probably a lot of other informal stuff that was never really recorded. So I would say that that was a conservative estimate.
And I think what this shows is even where there was enforcement, the vast majority of incidents only involved the issue of a fixed penalty notice.
That's correct.
And only a very small minority of cases required escalation to arrest.
Yes.
Can we then turn to page 25 and figure 11? And I'm looking at figure 11 at the bottom of the page. Now it's on the screen. Are you able to talk us through your findings as shown in this figure?
Yes. So on this was an analysis of the fixed penalty notices that had been issued, and we were interested to see what the ethnic profile of individuals who'd been fined was. The vast on the left, you can see the total absolute number of fixed penalty notices that were issued to individuals from different ethnic backgrounds, and you can see the by far the vast majority were issued to people from a white background, which includes white minorities, including people from Gypsy traveller backgrounds, is one of the main ones in Scotland, and that a kind of high level that maps onto the Scottish population, which is predominantly white. However, in order to determine whether there might be any potential disproportionality, you have to take the population figures and then calculate a rate per head of population for enforcement. So that's what you can see on the right. It's the estimate. We've called it the estimated rate because we use the most up-to-date population data, but there's always some level of uncertainty around population numbers that can change. So the estimated rate per 10,000 individuals within each of these ethnic categories. So you can see that actually when you look at population size, that individuals from Black, African or Caribbean backgrounds had the highest rate overall, and people from white backgrounds had the lowest rate per head of population.
I think overall, does this show that people from ethnic minority backgrounds were 1.4 times more likely to receive a fixed penalty notice than those from a white group during the pandemic?
That was correct, yes.
And I think that figure rises to 1.8 times more likely for somebody from an African, Black or Caribbean background by reference to the white population.
Yes, that's right.
Are these differences explained by differences in, for instance, compliance rates with public health restrictions amongst different ethnic groups, or do these figures show that there was disproportionate policing of people from Black and minority ethnic backgrounds?
We've been very careful in the reports that we've published to say that the analysis that we've done cannot be used to determine whether there was disproportionate or bias in actual policing. So in order to know whether there was bias in policing, you would need to know the level of compliance within each of these groups. You would need to know how many of those individuals had been encountered by the police, and then you need to know how many of them they find. We simply don't have that information. So it's impossible to say that there was any disproportionality in terms of the way in which the police were approaching.
Can you just pause there, please?
Yes.
Mr. Tarek, this is a really important topic. I'm just not sure it's one within my terms of reference.
Yes, I was going to move on, my lady. That I'm perhaps just following up on an interesting topic that's...
It is an extremely important and obviously an interesting topic, and I do understand that Professor can give us a great deal of help. I just think we're straying.
Yes. I wanted to move to some of the policing challenges during the pandemic, and these stem from Scottish Government regulations. Perhaps if it's possible to take the report off screen. In your statement, I think you state that in research interviews conducted with frontline police officers, they identified with difficulties with keeping up with frequent changes in the regulations that were being enacted by the Scottish Government. And some of these were made very much at the last minute. Are you able to provide specific examples of difficulties that this presented in terms of policing the pandemic?
Yes, indeed. And I think it is important to say that this wasn't unique to Scotland. In fact, Tom Hickman has produced a lovely paper called Abracadabra Lawmaking, where he describes producing regulations like pulling rabbits out of a magician's hat. So it wasn't unique to Scotland. It caused problems for policing mostly at an operational level. So when we were working with the IAG, it was a frustration of senior officers that the speed and frequency of the regulations was coming through without... I mean, it wasn't that the Police Scotland weren't consulted at all through the process, but things were happening so quickly, and quite often they weren't consulted until quite late on in the process, that the level of input that they could have to that was relatively small.
I heard in Module in London that sometimes they got a matter of hours' notice before the regulations changed. Was that the same here?
There was at least one occasion I can remember that the regulations had been enacted before the police even saw them. So, and actually there's no notice at all. And there's one really great example in the Holyrood Justice Subcommittee meeting, where the Chief Constable is being interviewed by the convener of the Justice Committee, and happens during the meeting to have something passed to them to say that there's new legislation coming in around introducing new police powers of entry, so that the police can go into properties where parties are happening. And the convener puts this to the Chief Constable in terms of the level of, the detail, and the Chief Constable, I think in quite uncomfortable terms, states that although he's aware of it and has seen drafts, he didn't know what was in the final version. So yes, it was a frustration of senior officers that they didn't always have sight of things. From an operational point of view, it causes problems when you've got a police force with over 17,000 officers, and you have to roll out training and instruction to frontline officers who are then going to go out and implement these new regulations. Now, I have to say that certainly in Scotland, Police Scotland took a very pragmatic approach to changes in the regulations, and they never wavered from emphasising the 4 E's approach and trying to minimise potential impact of any new regulations. But when we interviewed frontline police officers, they talked about, the difficulties of going on annual leave for 2 days and coming back to a completely new set of regulations, and they didn't understand what they were doing. We talked to supervisory officers who said their staff were coming to them for advice on specific incidents and issues, and they didn't know how to advise them. Frontline officers also talked about trying to find, information was being dripped down internally within the organisation, although it wasn't anything like the kind of training that officers would normally receive. Normally they'd have months, if not years, of preparation. And they didn't have anything like that. So they were going to Scottish Government websites to try and find out the information. But the Scottish Government website itself was blurring the difference between what was regulation and what was guidelines. So that didn't always help either. So, yeah, there were a lot of operational difficulties.
I think you say in your statement, and I think you've touched upon this earlier in your evidence as well, that the distinction between law and guidance was often not clear, not just to decision makers or the media, but also police officers. Is that based on the information you were given in research interviews and indeed your work on the independent advisory group?
Yes. What police officers said was that during the first lockdown, when the instruction was really clear, stay at home, then it was easy to operationalise the regulations. I mean, that's not to say there weren't some issues, particularly at the very beginning, before the 4E strategy really kicked in. But it was clear to the public what they were supposed to do. It was clear to the police what they were enforcing. As time went on and things started to be, ease up, and new regulations are brought in that provided for different circumstances, or an increasing range of reasonable excuses, or when they were introducing things like when they were talking about, there's a good example I want to give you of the First Minister talking about the exercising once a day. Now, there was a lot of discussion about exercising once a day, not just by Scottish ministers. It was only ever a law in Wales. It was never a law here. It was guidance. And when Nicola Sturgeon if I get my dates, in May 2020, on the 11th of May, she said at one of her daily briefings, the only change we've made here in Scotland is to the guidance on exercise. As of today, we have removed a once-a-day limit on exercise. It is one very minor change to the existing rules. So in her own statement, she conflates guidance and rules. And of course, taking their cue from her statement, it was widely reported in the media that the rule of one exercise a day, exercising once a day, had been relaxed. Now, it might not sound like a very big thing, but to those individuals who were trying to follow the rules to the letter, and who really stuck to things and were careful, seeing someone going out for a walk twice a day and thinking that was a rule and not guidance would have caused some problems within communities. We know that a lot of the calls that came into Police Scotland around people breaching the regulations were neighbours looking over the fence or the garden wall and cliping on their other neighbours. So it did make a difference that there should be clarity between what is rule and what is guidance.
And operationally, this would have, if the First Minister is using language that blurs between guidance and rules, that operationally must present challenges to the police when they're trying to work out where they can enforce and where they can't.
Yes. We weren't able to get access to data on the reasons that fixed penalty notices were rescinded. So rescinded is when the police withdraw the ticket and it's not pursued. But we are aware from discussions through the independent advisory group that a lot of the reasons for rescinding were where an officer had in good faith issued a fixed penalty notice for something that was guidance and not rule.
In your statement, you say that during meetings of the Independent Advisory Group, there were discussions with Police Scotland about new regulations that were considered very difficult to enforce. And you provide the example of regulations around quarantine restrictions on return from overseas travel as being something that was difficult operationally for the police to enforce. Can you explain what you were told about this issue in the Independent Advisory Group?
Yes, so in the Independent Advisory Group, one of the reports that we would receive on a regular basis was an update on some of the issues that were facing Police Scotland. They would quite often tell us about difficult cases, and they gave us a running report on issues relating to certain types of fixed penalty, one being travel and another being quarantine. And the difficulty that they faced with the quarantine regulations was that, so the quarantine regulations were really managed by Public Health Scotland. And if they could be dealt with satisfactorily through Public Health Scotland, then there was no recourse to the police. I think it was really only in cases where Public Health Scotland had tried to contact someone and hadn't been able to do that, that it was passed on to the police. Now, the police in these meetings told us that quite often the information that they were passed was incorrect. Phone numbers that didn't work, addresses that either didn't exist or the person wasn't there. But actually a bigger problem was that by the time Public Health Scotland passed the data on to the police to deal with, the period of the quarantine had elapsed. So there was really no point in the police taking up valuable resource to follow it up in any case.
You also say in your statement that travel restrictions, you'll recall the Scottish Government introduced in late December 2020, which banned travel between Scotland and England. That was another example, I think, you provide of where it wasn't practical to enforce. Was that an issue that arose in the independent advisory group?
Yes, and it was discussed both in the independent advisory group and John Scott and myself presented to the Holyrood Subcommittee on Justice, and it was discussed there too. Essentially, this was a ban on travel, cross-border travel between Scotland and England that was introduced on Boxing Day in 2020. And the specific concern was about the spread of a new variant in England, which hadn't really reached Scotland at that point. And I think the idea was we'll have a travel ban so that people don't bring this nasty new variant here. Although they also made changes to the local levels at that point, so it was actually quite a complex regulatory shift. So the First Minister announced this at the daily briefing on the 19th of December 2020 and stated that this travel ban would come in and they would be asking Police Scotland and transport operators to consider how the enforcement of this can be strengthened in the period ahead. So the insinuation is there's going to be pretty heavy enforcement of people crossing the border. Now, this is another example of where there's a tension between what the government wants to articulate through its messaging, and I can fully understand the intention in terms of trying to make people understand the seriousness of what this might do, but tension between that and the practicalities of policing. So almost immediately, Alan Spears, Assistant Chief Constable at the time, released a statement from Police Scotland to say that they would be continuing to focus on the 4 E's, that they were encouraging people to take personal responsibility, and they would not be routinely stopping vehicles or setting up roadblocks. On the day that the law came in, the Chief Constable reiterated that again, saying that the restrictions were preventative, and they did double the police presence on the border, but they made it very clear they would not be proactively stopping vehicles. And when John Scott presented to the Holyrood Justice Subcommittee, he described it as a restriction that was simply impossible to enforce. It's an example of something that's unworkable, and he gave an example of roadblocks that had been used, set up in Melbourne in Australia, which had caused absolute chaos and had not had the desired effect. So, yeah, so that was another example of something where a bit more communication between government and the police might have led to more harmonious press releases.
And I just want to move on to lessons learnt. I'm nearing the end of...
Just before we do, before you go to lessons learned, Mr. Chair, can I ask this? I heard in England about the drafting of some of these regulations, and it was the drafting went to the Department of Health in England, whereas normally it would be the Home Office responsible for drafting criminal justice regulations. And I suspect partly as a result, I mean, I had a look at some of the offences. I've got a background in criminal law, so and they were nonsensical. I mean, they wouldn't have made sense to, I suspect, a criminal law professor, let alone the poor police officer or alleged offender. What were the regulations like here? Were they better drafted?
Well, I've not compared. I've not, done a big study of.
Right, were they well drafted then? Don't do the
But there are examples of some of the regulations where it was absolute gobbledygook. There's one classic example of an explanation in a policy memorandum, which is trying to explain. It's the rule of 6, and it's trying to explain how many adults can meet. And how many children there can be and what the ages of the children can be. And it's about 2 or 3 sentences long, and it is absolutely impossible to fathom. And again, this kind of speaks to another issue of very fastly drafted legislation. I can see the intention was to try and be clear about, in this circumstance, based on our legislation, you can have these people. But it was impossible for people to understand. And you can see why police officers and members of the public would have been very confused about whether they were committing an offence or not.
And who did the drafting?
That I do not know, because I wasn't involved.
Maybe we can find out some other way.
Yes.
Thank you.
It's an area we can explore with subsequent witnesses, my lady. I now wanted to just turn on to lessons learned. In a future pandemics situation, is there a more proportionate response than using sanctions to enforce public health restrictions, in your opinion?
Well, if if you want to include a sanction, the only level down from a fixed penalty notice, which is reasonably proportionate if you keep them at a low level that the public expect, there's an inherent inequality in financial penalties. A fine of £60, which is the minimum, a fine of £60 for a government minister might be a small amount of pocket change, but that might be quite a large amount of money for someone who's experiencing financial hardship. And remember that the person that commits the offence doesn't need to pay the fines. So there are individuals who did have fines paid for by other people, including a number of well-heeled students. And that inequality is offset by the fact that these sorts of on-the-spot fines are relatively pretty small. But when you start to ratchet up the fines to hundreds of pounds, that's not a small fine anymore, and that inherent inequality is quite large. So, sorry, I've forgotten the original question, but
what's the proportionate response?
A proportionate response. I mean, if you kept the fines low level, you continued with the 12 E's. I'm sure we could find a few more. The 4 E's approach, and you improved lots of other things like more consistent, clear legislation that was distinct from guidance and focused on supporting people to follow the rules rather than punishing them for not following the rules. Then if you were to move away from a fixed penalty, then a formal warning would be the next level down. I think you have to remember that laws are there for the majority, for the most part, to deter the law-abiding majority. And in the context of the pandemic, most people were the law-abiding majority. We've talked about enforcement today, but in Scotland, less than 0.5% of the population were subject to enforcement. So in the grand scheme of other inequalities and impacts the pandemic had, enforcement might seem quite a small thing, but it did impact on thousands of people, and it impacted disproportionately on people from more deprived backgrounds and individuals from certain social groups. So I think it's always important to try and minimise the effect of any sanctions in the context of a public health emergency where there are lots of other inequalities that are going to be impacting on these individuals. And very often the inequalities intersect. So the people who were subject to repeat fining, for example, were highly likely to be people who were also impacted in terms of health and economics, potentially education as well.
My lady, there's no further questions from me, and I understand there's no live Rule 10s.
Thank you very much indeed, Professor McVeigh. Very grateful. As you say, there are many people where the impact was dreadful, but one of the lessons to be learned is that when you impose what are essentially criminal sanctions, even if you don't end up with a criminal record, you've got to make sure you get it clear and right. And maybe if we're being better prepared all of us before, we might have had some draft bills or offences that we could have implemented. Who knows? But thank you for your help.
You're very welcome. Thank you.
I think it's 10 o'clock tomorrow. For those who were interested in seeing the evidence of Alistair Jack MP, for reasons that are not his fault, they're not the inquiry's fault, I'm afraid we can't call him tomorrow, I understand. So we'll start with Elizabeth Lloyd. But we hope to call Mr. Jack next week.
Thank you.